What is this? AMBU. Squeeze. O2. Full. Interns, snap out of it. Don't stop the compressions. Why yes. Who is it? Somehow. It feels familiar. 200 joules, charge. That didn't come back. CPR. Stop. I will declare the time of death. Patient Kim Jiangsu. 322. Deceased. What the? Did I fall asleep again? I can't be like this. Today's going to be brutal. Focus. Yeonguk University Hospital Dr. Shin Seonhan YK. Seonhan. Seonhan mom and dad are home. You've been waiting, right? Seonhan. What are you do? Why are you holding a knife? Are you okay? Honey. Seonhan, I sliced some rockfish sashimi. My father, calling me a prodigy with knives, had already decided early on that I would inherit the Shin family sashimi business. I grew up naturally believing I would take over the restaurant. But one person who I met by chance led my fate down a different path. Today, we're honored to hear from Korea's greatest genius surgeon, Professor Baek Ui-sin. Then for our final question. Could you give a word of advice to medical students who dream of becoming the next Baek Ui-sin? What qualities are necessary to become a great surgeon like you? Well. I'm not sure. I don't think I'm a great surgeon yet. Professor Baek Ui-sin, praised as the hand of God at Johns Hopkins Hospital, you're far too humble, Professor. I still believe I have a long way to go. However, in Europe, a saying has been passed down for over 200 years. To become a great surgeon, 3 things are required. Eagle's eye, lady's hand. And lion's heart. A doctor must have keen observation like an eagle's eye. And hands as gentle, kind, and considerate as a lady's. At the same time, they must possess the bold courage and decisive strength of a lion. Baek Ui-sin. So cool. At that moment, my heart, like a ray of light shining upon me, who'd lost my master and mother passed away. Something was awakened. A bright and clear goal was set in my heart. Helpful to those around me, I'll bring them joy. Father. I'm going to become a doctor. No. What? Why not? Shouldn't you be happy your child needs to become a doctor? You. What kind of family do you think we are? A long-standing merchant family for 30 years. Reported in local news. Appeared on TV 12 times. A legend. A sashimi making. The Shin family fish restaurant. That's right. Your destiny isn't being a doctor, it's wielding a sashimi knife. Seonhan, you're a born knife wielder just like me. Use your talent and inherit the family business. I like cutting fish with a knife, but I want to become a doctor who saves people with a knife. Still no. Why not? Why can't I? Your child wants to study hard and become a doctor. That's exactly the problem, Seonhan. You take after me, your head's kinda dull. Sorry, son. Our family just isn't built for studying. That's why being a doctor is impossible. That's the realm of the impossible. So quit talking about being a doctor, now. A precious grouper came in from Jeju today, try slicing it. No. If I can't do it, I'll keep trying. Again and again. I will. I'll definitely become a doctor. Wah. But I won't give up. I will get into medical school. Seonhan. My skirt ripped. Sew it for me. Do your own sewing. Stop shortening your skirts and lose some weight. Hurry. Hurry. Wow. Perfect fit. Get out. I need to study. I was good at sewing as well as knife work. And time passed after studying like my life depended on it, senior year exams. Admission results check. Failed immediate retake. Failed third attempt begins. There is no such thing as giving up. And then. After 3 attempts. Finally. I became a medical student. If nothing happens, I'll become a doctor. Or so I thought. The school closed, but thankfully I passed the medical licensing exam. And I was accepted as an intern at Yeonguk University Hospital. Yeonguk University, one of Korea's most prestigious universities. One of Korea's so-called Big Five hospitals. 8,000 outpatient visits daily. World-class medical care trusted by all. Over 2,000 inpatients receive treatment here. Of course, the doctors, nurses, therapists, technicians, and others working here. The number of medical professionals also reaches into the thousands. Although he is no longer here, this is the place where Dr. Baek Ui-sin, whom I respect, once worked. That's the biggest reason I applied here. But the process of becoming the doctor I truly dream of starts now. Hello. Dr. Seonhan. Room 1705 patient has chest pain, AH. Then we should do an ECG. Yes, please. Okay. Chest pain/ECG, electrocardiogram in cardiology wards, quick ECGs are crucial. The ECG results different from yesterday. Should we notify the attending physician? Really? What's off? It's AFib, not critical yet, but we should monitor it. AFib, atrial fibrillation. For your first rotation, you're very thorough. Keep this up and everyone will love you. I hope so. Why are you all chatting? Not working. Third-year resident Kim BMSU, common name, Kim BAEM. Hello, Kim Bae. I mean Dr. Kim. Senior, he's from Ilin University. Ilin. The third-rate regional school that shut down last year for corruption. That one. Did you check room 1705? Yes. ECG here. What about last night's record? Here it is. It shifted from normal sinus rhythm last night to AFib this morning. Still not severe, but worth checking. HIK. Did I mess up? Ilin University, what's your name? Yes. Shin Seonhan. Good job. This is how interns should notify properly. Phew. Thank goodness. It was worth preparing the records in advance yesterday. Intern evaluations are ultimately decided by chiefs and professors, but residents are the first evaluators. I must leave a good impression. Well. If a grad from a trash school wants to survive here, you'll have to work hard. Work hard. Learn as much as you can before you leave. Learn. And leave. So he's saying I don't really have a chance to stay at Yeonguk. In the end, it all comes down to intern evaluation scores, but no matter how hard you try, it's tough for graduates from other universities to survive here. Even if it's unfair. That's just the reality. I came here prepared for that. Well, if you know that, then fine. But still, just in case. If you were chosen as Intern of the Year, there might be a chance. Intern of the Year. A title awarded each year to the most outstanding intern at Yeonguk University Hospital. So if I selected as Intern of the Year. Come on, senior. Why are you giving him a false hope? A graduate from another school has never been chosen as Intern of the Year. Well, either way, you do have a chance, so give it your best. Yes, sir. I look forward to working with you. Damn academic elitism. Just watch me. I'll survive at Yeonguk no matter what. And someday, I'll be recognized as a great doctor, just like Professor Baek Ui-sin. Hello, Seonhan. Have you had lunch yet? Yeah, I'm about to go. What about you, Yeonseo? Not yet. I'll eat after I finish this. Finish what? Surgical consent forms. I need to submit them soon, but I still have 5 left. It never ends. I even have a procedure later. Consent forms. Hand them over. I'll take care of a few. Really? Hurry up and finish, then go eat. Thank you, Seonhan Oppa. You saved my life. I'll buy you coffee later. Let's see. What kind of patients are these? Kim. Jiangsu. I will pronounce the time of death. Patient Kim Jiangsu. That's the name I heard in my dream. 3:22 a.m. The patient has passed away. No way. It can't be. It's just a coincidence. Right? Inpatient ward room 1108. Patient Kim Jiangsu, please confirm the consent form. Grayish hair. Sunken, drooping eyes. Dark skin. It's definitely the man from my dream. That patient. Kim Jong-su. Doctor, is something wrong? A.H. Right. I'm here to explain the procedure you'll be receiving today. The same name. The same face. It's just a coincidence, right? Doctor. Yes. My dad is going to be okay, right? Oh, okay. What do you mean? Well, IT says here that he could die. Please, don't worry too much. We only list those because we have to include every complication that has even a 0.001% chance of happening. PCI is a procedure we perform more than 10 times a day. Every patient who had it this past week was discharged without any issues. It's extremely rare for a patient to die from an accident during this. Oh. I see. This is Yeonguk University Hospital, after all. The best doctors in the country are gathered here, so everything will be fine. Dad, you heard him, right? Don't be so scared. Right. Yawn, 8 p.m. I can finally see the light at the end of the tunnel. Of course, this isn't actually the end. Because I'm on night duty today. You're here. Kim Jong-UK. You're working out already. Naturally. If I skip a workout, I'll lose my gains. You look like hell, though. Don't even get me started. Pages were exploding left and right, I've been working like a dog. Anyway, did you hear that rumor? What rumor? They say that every March, when the new interns arrive, a major accident always hits the hospital. Apparently, it's a long-standing tradition here at Yeonguk University Hospital. Stop jinxing US. Muffled, you're putting a curse on US. What could possibly happen? Let's just hope for a quiet night shift. I hope so too. Muffled, that would be nice. In the dream I had, the patient Kim Jong-su died. If that actually ends up coming true. Wait, what am I even thinking? Let's not get carried away with such ridiculous thoughts. What are you doing? Are you seriously studying? I just have something I need to look up. What book is that? Coronary heart disease. Wow. I can't believe there's an intern actually cracking open a textbook to study. I'm sure things won't turn out like the dream, but maybe. Just in case. I'll just prepare for that 1 in a million chance. Ugh. Have to take calls, and study. It's been a while since I studied, this is exhausting. Code Blue Adult Male, CPRM. Code Blue Adult Male, CPRM. Main building, 17th floor, West Ward, treatment room. GUNYUK. Run. CPR, cardiopulmonary resuscitation. Literally a situation requiring life-saving measures. It is the most critical emergency that can occur in a hospital. It means a patient's life is hanging in the balance every single second. Wait. Wait for me. The 17th floor. You told me earlier the patients there were stable. I don't know who went into arrest either. It was dead quiet in the ward when I left after doing dressings. Hey. You interns. A patient is hovering between life and death, and you're just getting here now. Are you slackers already coasting only 1 month into your internship? Huh. We're sorry. One of you, take over the AMBU bag. The rest of you, line up for compressions. Yes, sir. Unless a patient in cardiac arrest achieves ROSC, return of spontaneous circulation, cardiac massage must continue for at least 30 minutes. It's Kim Jong-su. How did this happen? Is the dream really becoming a reality? Charge to 200 joules. Clear. Shock. Charge. Shock. Rhythm is back to normal. Emergency over. Listen up, interns. Every second you're late is a second shaved off a patient's life. Do I make myself clear? Yes, sir. Alright, once a patient is intubated during CPR like this. How often does the guideline say to squeeze the AMBU bag? This is a test. How many seconds was it? Hesitating that's. It's not a difficult question, but everyone freezes when put on the spot like this. Look at this. Can't even give me a straight answer. Is this really the caliber of interns we're getting at Yeonguk University Hospital? I shouldn't let this drag on. Given that guy's temper, there's no telling what kind of verbal abuse he'll hurl next. Once the airway is secured, once every 6 seconds. You have to provide a breath once every 6 seconds. And the diastolic pressure during compressions? Intra-arterial pressure must be maintained at 20 mmHg or higher during diastole. What's the dosage of amiodarone for a shockable rhythm? 300 mg bolus for the first dose. Followed by 150 mg for subsequent doses. Well, at least one of you has his head on straight. That's only because I've been thinking about this all day. The scene from my dream this morning was so vivid that I've been replaying a CPR scenario in my head for hours. If I hadn't, I wouldn't have been able to answer that quickly either. The rest of you, wake the hell up. It's pathetic that you can't recall the basics instantly. For real. Especially you Yeonguk grads. Aren't you embarrassed to be outshined by someone from a bottom-tier school that doesn't even exist anymore? What are you doing? Get moving, all of you. Whoa. That ended sooner than I thought. What's gotten into the snake? He let us off easy today. It's all thanks to Seonhan. I don't even want to imagine the earful we would have gotten if we hadn't answered. Seriously, why is that guy's personality such a train wreck? I'm never going into internal medicine. I refuse to look at his face ever again. Unlike in my dream, Kim Jong-su survived. But what is this feeling? This lingering anxiety. Like I'm missing something vital. Patient, Kim Jong-su. Time of death 3:22 a.m. AM 2:40. 2:40 a.m. The time in my dream was 3:22 a.m. Everything from the dream has already been perfectly reenacted. If the rest of the dream becomes a reality, then Kim Jong-su will be dead in 40 minutes. You guys head back first. What? Hey, where are you going? I'm worried about that patient from earlier. Huh? Seonhan. Wait. I'm coming with you. Was there anything unusual about this patient? Unusual. Let me think. Oh. I passed him in the hallway earlier this afternoon. And I smelled cigarettes on him. Cigarettes? Yeah. I wondered for a second if the smell was actually coming from a patient, but I was too busy to check. Of course, smoking isn't immediately fatal. But if he couldn't even resist a cigarette right before heart surgery, then how much does he usually smoke? Kim Jong-su HTN/DM/dyslipidemia, +/+/+, smoking HX, +80 pack, year ejection fraction 35% PCID/T unstable angina. HTN/DM/dyslipidemia, +/+/+, smoking HX, +80 pack, year ejection fraction 35% PCID/T unstable angina. It's severe. It's not just that. Hypertension, diabetes, hyperlipidemia. He has every single sign of bad blood vessels. And his ejection fraction is only 35%. In other words, his heart's pumping function is significantly low. Wow. Looking at this now, it wouldn't have been strange if problems arose right after the PCI procedure. You think so too, right? PCI, percutaneous coronary intervention. It sounds difficult because it's a medical term, but the concept isn't that complex. Our bodies have blood vessels called coronary arteries that supply blood to the heart. However, if these coronary arteries narrow, blood cannot be sufficiently supplied to the heart muscles. PCI is a procedure that artificially widens this passageway. It involves inserting a small metal tube called a stent into the blood vessel to create a sturdy passageway. However, since it involves inserting an artificial device into the body, problems can occur. Then how does this patient end up dying? He definitely returned to normal earlier. How does this patient die? Just remember one thing, damn it. Refractory VFIB. Refractory ventricular fibrillation. Refractory VFIB, IT refers to a vicious cycle of repeating ventricular fibrillation that does not respond to multiple shocks or medications. If that happens, the probability of the patient dying is extremely high. Doesn't IT seem strange? What does? Look at the ECG, electrocardiogram, rhythm over there. Look at the APC and VPC passing by. Look. It's changing little by little from normal. I can see strange waveforms like static noise too. Well. I'm not sure. Now that I hear you say it, maybe. I need to say something right now. About what? That the patient is in danger. Huh? Are you serious? What? I complimented you a little earlier, so now you're trying to teach me? Sorry. That's not it. If that's not it. Usually, when a first-week intern gives advice to a third-year resident. How exactly should I interpret that situation? Who told you to judge the patient's condition on your own? If you're an intern, just doing what you're told properly is half the battle. What do you know to be acting up? Damn it, I knew I shouldn't have said anything. Right, let's just go back quietly. It's not like I'm some future-seeing superhero. So. Tell me more about your opinion. Pardon? Isn't diagnosis and treatment the basic foundation of a doctor? Is our fresh Dr. Shin raising an issue without any countermeasures? Why? Now that you've spit it out, are you scared you can't take responsibility? Speak up, Dr. Shin Seonhan. Screw it. I can't back down at this point. I thought the patient might need ECMO. ECMO? ECMO. An external support device that replaces cardiopulmonary functions. Think of it as connecting a machine outside the body that acts as a substitute heart. It is called the last lifeline for patients with critical heart conditions. This is because it is considered the final bastion when there is no possibility of resuscitation through artificial respiration, CPR, or cardiac massage. Ha! I wondered what an intern was thinking. Did you even see ECMO being used during your clinics at Yeonguk University? Don't tell me you saw it on the news and are pretending to know. In Korea, ECMO became famous as the machine used by conglomerate heads to extend their lives. During the global coronavirus pandemic, many patients survived thanks to ECMO. Do you think ECMO is a panacea? It's used as a last resort in extreme situations. But, considering the patient's current health status and the condition of 35% ejection fraction, I think we cannot rule out the possibility of refractory VFib occurring. Ha! A patient who had VFib and recovered is sitting there fine, but you think refractory VFib will come back? Is that your opinion right now? Yes. Damn it, I finally did it. An intern dared to act up against a resident with strong pride, so there's no way he'd be happy. What's certain is that I can forget about getting a good evaluation in internal medicine. Well. The possibility isn't entirely zero. Dong Siep. You're on duty today, right? I've explained the situation to CS, cardiothoracic surgery, and moved him down to the ICU for now. Are you satisfied now? Yes. Thank you. I've never seen an intern like you. Anyway, your name. Those 4 syllables, I'll definitely remember. Dr. Shin Seonhan. Oh Appa, that was amazing. It's my first time seeing an intern look Senior Kim Senior Kim BMSU in the eye and talk back. I don't know what kind of guts I had to say that either. I'm screwed, right? But OPPA. You looked kind of cool. Huh. You looked like a real doctor. Ahahaha. Thanks. If the dream is correct, the second CPR should happen soon. But no matter how long I wait, there are no signs of it. Yes. Intern Lee Wyoneseo. That was rough. Arg. You're tired, right? Let's go back now. Huh. You're not checking the patient more. I think I've seen enough. I guess I worried for Nothi. It's VFIB. Doctor, hurry. CPR. CPR. Doctor. Wyoneseo, squeeze the AMBU. Alright. So the dream really was true? How on earth should I accept this? What happened? It's V-fib. Damn it. Switch positions. 1, 2, 3. It's exactly the same. AMBU, squeeze. O2 full. Interns, get your grip. Exactly the same. Every detail matches the scene from my dream. It's still V-fib. Stop compressions for a moment. Charge to 200 joules. Shock. Everything is exactly the same. Then if this continues, Mr. Kim Jeong-soo will die. D-Dad. In the end, there's nothing different from the situation I saw in the dream. Was I powerless to change the future? Move aside. The only people who can save the patient in this desperate situation are here. Thoracic surgery. Thoracic surgery specialist Song Yeju. How long has it been? S6 cycles. 12 minutes. I'll use both femorals, step back. Starting ECMO insertion. Starting from the medial side, van. T/N, van, vein, artery, nerve, let's secure the vein first. Guide wire. Yes. The guide wire has entered the IVC. IVC, inferior vena cava, a large blood vessel returning blood from the lower body and abdominal organs to the heart. Guide wire, a tool to safely and accurately insert the ECMO catheter, guiding it through the vessel. Next, the artery. It'll be bright red because it's oxygenated. Yes, senior. Oxygenation, supply of oxygen. Amazing. Every step is proceeding like a precisely tuned machine. Oh. Senior song. The regurg suddenly stopped. Regurg, blood being sucked out through the syringe. Stop compressions. Okay. Now, move the syringe slowly while pulling. Yes. Done. Yes. Now slowly push the guide wire in. Stop immediately if you feel any resistance. If you force it, the vessel will break, and the patient will die. Guide wire is in. ECMO on. Flow is good. No recirculation either, seems good. Patient's breathing is normal. Good work, everyone. Phew. 3:22 a.m. Exactly matches the time of death I saw in the dream. But Mr. Kim Jeong-soo did not die. He is connected to ECMO, his second heart, and his life has been extended. Now we just need to find the cause and fix it through surgery or another procedure. Ha! What happened? Suddenly had V-fib in the early morning, and CPR was repeated. Rhythm didn't return, thoracic surgery inserted ECMO. ECMO? Yes. Luckily, the internal medicine team called ahead to prepare, so IT wasn't too late. Dr. Kim Byung-soo requested ECMO in advance. That's. Oh dear, good job, well done. That was close. As expected of Dr. Kim. Ha ha ha. So what I saw really was the future. How is that even possible? Are you okay? You look pale. Did you overdo the compressions? Oh yeah. What about you? I only did AMBU bagging. That's all. But how did you know? That patient Kim Jeong-soo would relapse into V-fib. Well. I want to know too. To call it a coincidence is impossible. Every detail was exact. I can only think that I really saw the future in a dream. I guess you could say it was a hunch. A hunch? Gasp. Senior. Step aside if you're not getting a drink. Somehow, your guess was right this time. Moving him to the ICU and calling the ECMO team was a very good move. But don't get cocky. You just got lucky this time. Good job, reckless intern. Kia. OPPA, you just got a confession. What? I've never seen that senior give anything to anyone. Giving you a drink is practically a love confession from Kim Snake. I don't know. What is that? Scary. I don't want to receive something like that. Phew. But what was that dream really? It showed everything that was going to happen exactly. How is that even possible? I'm not some superpowered person. Yeah. Whatever. Don't think too deeply anymore. One patient was saved. That's enough. Oh whoa. Man, I feel alive again. Phew, how long has it been since I had a day off? It's only been 3 weeks since I started my internship, but it feels like it's been 6 months. I'm going to work out. What about you? Working out again? I'm going home to catch up on some serious sleep. Seonhan. Ugh. Do you have a vendetta against my back? Your back is so wide, it feels great to hit. Hiss. It's a back that begs to be slapped, you know. Smack. Smack. Oh, right. How did that patient's surgery go? Mr. Kim Jeong-soo. I heard the surgery went well in thoracic surgery. There were no issues, so he should be discharged soon. That's a relief. Ever since that incident, it's been weighing on my mind like a thorn. Now I can finally relax. Oh, you're going there today too, right? Where? Didn't you get a text from Jin Ji? He said the interns are getting together for a beer today. I didn't get one. Huh? Really? He must have missed you. Come with me. GUNUK, you're coming too, right? I'll pass. You two go. I'm hitting the gym. I should just go home and sleep. No way. The weather is too nice to just sleep. Wait. Let's go. Hello, everyone got here early. Oh ho. The goddess of Yeonguk Med School, Lee Yeonseo, has arrived. Oh please, goddess. That's ancient history. We've already graduated, so cut it out. Sit here, Seonhan. Why is that guy from the trash university with Yeonseo? Kuh. How long has it been since we tasted freedom? This is my first time out since starting the internship. Can't neurosurgery, go out even on off days. By the time I finish PREOP prep and patient dressings on my off days, it's always past IOPM, so I just pass out in the dorms. Haha. Suffering through an internship after 30. Since he went to med school after the army and even got held back a year. But today, I swore I'd make it out, so I crawled my way here. Drink. Drink. I'm getting wasted today. Everyone, raise your glasses. As expected, the Yeonguk grads all seem close. Since they've known each other for years in that small university. It's a bit enviable at times like this. Come to think of it, what was your name again? Shin Seonhan. Right? Yes. That's right. Please, speak comfortably. Shall I? Here. Have a drink. How is it? Is it bearable? Must be tough adapting since you're from another school, huh? Yes. I just need to work harder. Don't even start. Haven't you heard the rumors about Seonhan yet? Huh? What rumors? Last week, Seonhan completely owned Snake Kim. I mean, he actually. Kim Snake bought him a canned coffee for doing a good job. You sure IT wasn't poisoned? See crazy. Jesus. The end of the world is here. Amen. Bodhisattva. He's a total ace. An ace. To land a punch on Rattlesnake Kim. Good job. Good job. It's an honor to meet you. Let's have a drink. Luckily, I won't be left out of the mood today. By the way, what specialty are you guys thinking of? The topic that never fails to come up when interns gather. Pediatrics, otorhinolaryngolodermatology, plastic surgery, orthopedics, choosing a major. Which field to choose as a doctor? Since the chosen major usually becomes a lifelong career, IT is the most important decision for an intern. I may be big, but I'm actually the scholarly type. Maybe rehabilitation medicine or radiology. Do you really want to spend your life staring at CT scans in a dark room? I'm thinking anesthesiology. Anesthesiology is the trend these days. You know, tons of pain clinics are popping up downtown, right? Yeonseo, still pediatrics? I'm not sure. As a student, I loved seeing the babies, but my friend rotating in peds right now says it's really tough. True, they say peds guardians are the scariest in the world. No thoughts on dermatology? Traditionally, the pretty and smart female seniors always went to derm. Hee. I'm considering a few things. It goes without saying, but the popular specialties are already set. The so-called PN-Song, dermatology, ophthalmology, plastic surgery. And Jongjae-Wenji, psychiatry, rehab, radiology, and so on. Specialties where you can open a clinic and hit the jackpot, or ones that are relatively less physically demanding tend to be popular. Of course, preferences vary wildly depending on individual personality. Seonhan, what specialty are you thinking of? MME. I'm curious too. Wonder what the guys from other schools have in mind when they come here. I'm thinking of surgery for now. Oh ho, a purist. I applied to Yeonguk University Hospital, thinking of GS, general surgery, or NS, neurosurgery. I saw the thoracic surgery team last time, and they looked cool too. Oh ho. TS, thoracic surgery. There is a reason for this reaction. Surgery, and especially thoracic surgery, are the most avoided and unpopular specialties. Dangerous, exhausting, and f***ing intense. But why surgery? Let's begin. Scalpel. It looks cool. Kohaha, he's got romance. A romantic. Right, right, who cares about Song anymore? These days, you just do what you want. You're cool. Shin Seonhan. Drink up. Thank you. Cool, my ass. It's not like you want to do it. It's just the only choice you have. Hey, be honest. You're from some ruined trashy provincial school anyway. You can't even dream of the other departments. So you figure surgery is worth a shot. That's what you're thinking, isn't it? Hey, Joe Jinji, you punk. Are you drunk? Why are you talking like that? Why? Am I wrong? Honestly, he's not even from Yeonguk. Does he think he can get into a popular department just because he wants to? You're all just pretending to cheer him on. One competitor down. Don't you? Huh. Am I the only one who thinks so? Am I the only trash here? Hey. Someone shut him up. This bastard is drunk. Hey, someone go after him. Why does Joe Jinji hate me so much? I don't think I've ever made a Seonhan, that jerk is wasted. Don't let it get to you. No. It's fine. There's no guarantee I'll only meet good people during my hospital life. Surprisingly, there are many people who lack social skills because they spent 3 years in high school and 6 years in med school doing nothing but studying at a desk. Test scores and character aren't proportional, after all. Just because someone is a doctor dealing with precious human life and health, it never means they are mature as a person. This is. Again. It's exactly the same as back then. Hey. Grab him. Hey. Joe Jinji, you crazy bastard. Who? How could you drink so much you can't even control your body? Hey Seonhan. Seonhan, are you okay? Huh? Seonhan. Seonhan, what's wrong? You suddenly look like you've seen a ghost. Huh? It's nothing. What the? Did I have that dream again? Will the exact same thing happen again this time? No. It can't be. Last week was probably just a coincidence. I'm not some kind of psychic. Yanseo, I need to use the restroom. Sure. Go ahead. Should I have just gone home and slept? I keep having weird dreams because I'm tired. Joe Jinji ruined the mood anyway. I should say bye to Yanseo and leave early. Huh. The alcohol crates I saw in the dream earlier. Hey. Grab him. Hey, let go. I said I'm fine. Huh. Ugh. Hey. Joe Jinji. Are you okay? Ugh. What is this? Huh. Seonhan, are you okay? I'm fine. What the? The exact same thing happened again. Do I really have precognitive powers? Let me organize what's happened so far. Precognition happens suddenly. 2. While having a vision, real time seems to stop. Precognition shows incidents and accidents that will occur nearby. The timing of precognition is irregular. It could be 10 minutes later or 24 hours later. So far there have only been 2 cases, so I can't be certain, but if I'm right, this phenomenon might occur frequently from now on. Because incidents and accidents happen constantly in hospitals. And if I see the future again next time, I'll have to make a choice. Whether to change the future with my own hands, or leave it as it is. With my choice, I can change the future. With my choice, I can change the future. And so the eventful month of March came to an end. Grandma, did you sleep well last night? Oh my, Dr. Shin. Is it true that today's the last day I'll see you, doctor? Oh. How did you know about that? I heard from the nurses. I'm so sad, what should I do? I'm not going far. I'm just going to a different department in the same hospital. Let me draw your blood one last time, Grandma. Oh my, doctor, how are your hands so smooth? They're like a young lady's hands, that's why when you draw blood, it doesn't hurt at all. Oh really? When other doctors poke me, it hurts. I'll make sure to do it quickly and painlessly till the end. Yes. Success on the first try. See? It's done already, right? So you won't come anymore. I wanted to marry my granddaughter off to Dr. Shin. Wow, if your granddaughter looks like you, Grandma, she must be really pretty. Of course. She looks just like me. How old is she? 11 years old. She's in 4th grade, reads books well, and knows her multiplication tables perfectly. Oh grandma, I'm getting arrested. Dr. Shin, you're really good at drawing blood now. Really? Of course, you can tell just by looking. You can roughly tell whether interns have talent for procedures or not from their first rotation. Note, procedure. Procedures refer to medical techniques used by doctors. From simple tasks like drawing blood or inserting a urinary catheter, to major surgeries like gastrectomy or pneumonectomy all fall under the realm of procedures. Accurate and delicate procedures can completely change a patient's treatment outcome. Someone who isn't proficient at small procedures can't perform large procedures well. And that process starts from the intern year. From the head nurse's perspective, how do you think I am? Am I at least average? Honestly, you have the best hands of any doctor I've seen. And you're skilled at dealing with patients too. I'm sure you'll become a good doctor no matter which department you go to. Sob. Getting praised by the head nurse brings tears to my eyes. Oh, you're good at acting cheeky too. Dr. Shin, where did you say your next rotation is? This time it's. Hey, defunct university guy. Yes. Drink. Follow me for ACC, th. Thank you. Today's your last day in internal medicine, right? Where's your next rotation? Yes. Emergency medicine. Emergency? That'll be tough. Emergency means Yeo Bong Chol. But you said you want to go into surgery, right? Yes. Huh. Has word already spread? It seems there are no secrets in this damn hospital. That's good. If you said you were coming to internal medicine, I was going to half kill you. After experiencing internal medicine, IT really does seem attractive. Ha, ha, ha. Get lost. I'm not accepting. Don't come. Work hard in other departments too. Don't embarrass me since I had you for your first rotation. You did well this month. Yes. I never expected to have this kind of relationship with the prickly Dr. Kim Byung-soo. In the end, hospitals are places where people live rubbing shoulders with each other. People and situations change depending on what attitude I have and how I act. And so March ended. Now new intern life in a new department awaits me. I'm screwed. A total of 8 interns are assigned to the emergency room. They must work in shifts of 24 hours, divided into groups of 4. For the next month, 4 people will have to work as a community of shared fate. But Yeonguk University's oldest slacker intern Oh Young-won-hyung. Hey Shin Seonhan. We're on the same team. Let's work well together. Useless Jo Jin-gi. Why did these people have to be on my team? Hey, but Jo Jin-gi man. What about your hand? Even if you fell and got hurt, why did it have to be your hand? Even if you became a eunuch, you should have protected your hands. Can't be helped. They said I have to be like this for a month. With your hand in a cast, you can't do tough work. Hee hee. You're laughing. You sneaky bastard. If you can't do it, we all have to take on your work. I'll be in charge of all consent forms. Heh. The emergency medicine department is already famous for being tough, and now one of our colleagues can't use their hand. It's literally a catastrophe. Seonhan. What should we do? Of all people, this guy's on the same team. We just have to work hard. I'm trusting everything to you. Pardon? Hyung's old, it's tough. You're the ace, right? I'm counting on you this month. Number 1 slacker Young-won-hyung. This is not good. Ever since college, whenever groups were divided, I had bad team luck and everything went wrong. Intern evaluations are the same. Who you're on the same team with is much more important than when you were a student. Let me get through. A. Hamster. So damn. You're here. You're on our team too. So damn. You're seeing So damn for the first time, right? Super royal among Yeonguk University royalty, So damn. Royal? Starting from her grandfather, everyone's been a professor at our medical school. I bet there's not a single professor at our university who doesn't know So damn. All the professors say, our So damn, our So damn. Make sure to get on her good side. Oh right. Here, everyone take a drink. Why did you buy so much? Man. It's the first day, so I bought bread and drinks for the professors. This is what you call social skills. Can I have one of those breads? Man, why are you eating that? That's for the professors. So damn. You take one too. So, royal among royals. I'm from a defunct university. Ha. Will this really be okay? With these members? Oh dear. Are these the new interns? Emergency medicine third-year resident Yeo Bangcheol. Hello. Right. You're the day shift today. Geez, when are they gonna send US proper people? Nice to meet you. I'm Yeo Bangcheol. Anyway, let's work well together this month. Yes. Follow me. You got the handover, but let me roughly explain the emergency room. Do you know what apocalypse means? What? Isn't IT like the end of the world? Pillars of fire falling from the sky and gates of hell opening below. Right. You know well. This here is exactly that. Doctor. Please look here quickly. It's a stroke patient. Call neurology quickly. Hey, my father came earlier, so shouldn't you see him first? Oh, my stomach hurts so bad I'm dying. I'm dying. Bed 6 has a suspected me patient. Please see my child, doctor. Doctor. Welcome to the apocalypse. Welcome to emergency medicine. Doctor. Please take a look here quickly. It's a stroke patient. Call neurology right now. Hey, my father came earlier, so shouldn't you see him first? My stomach hurts so bad I'm dying. I'm gonna die. Suspected me, myocardial infarction, in bed 6. Please see my child, doctor. Doctor. Even though it's still early morning, the ER beds are already packed with patients. A college student complaining of abdominal pain. A woman in her 50s with severe constipation. An office worker in their 30s vomiting from dizziness. An elementary school student bitten by the neighbor's dog. A foreign laborer who injured his fingers at a construction site. It's a completely different scene from the internal medicine ward, where patients had similar symptoms. In a place with 100 patients, there are 100 different symptoms. That place is the emergency room. You lot. Do you know what a hospital ER is for? Treating critical patients. That's the obvious part. The ER treats the most urgent patients first, then sends them to the appropriate departments according to their symptoms. So, in emergency medicine, you have to be good at all clinical fields. Got it? Yes. Alright, shall we get started then? Everyone, follow me. Does your stomach hurt a lot? Yes. Bend your knees for me. Where does it hurt? Here. IT doesn't hurt there. Ow ow ow. I think it's only the upper part that hurts. Nothing special on X-ray or sono, ultrasound, and lab, blood test, results are fine too. Then it's probably not appendicitis, most likely gastritis. Yes. If your lower right abdomen starts to hurt, you need to come back. It could be appendicitis. Quickly assess the patient's symptoms and take the most necessary action. Simple cases like this might be ones you handle as the primary, first scene, doctor. Understood? Yes. Next. Ma'am, you'll need an enema. Empty out cleanly and then go home. There also seems to be a slight problem with the ear, so Ent will take a look. Fortunately, the dog bite isn't too deep. We'll disinfect it and give you a tetanus shot. You. Stand. KO. Reen. Right? The wound. Is a bit. Deep. So plas. Tick. Sir. GE. Will. Stitch. IT. Up. Don't. War. IT. Shouldn't. AF. FECT. Your. Fin. FUNC. TON. Don't. War. Thank you very much. So cool. Internal medicine, surgery, and plastic surgery. He instantly grasped every patient's condition alone and gave appropriate treatment right away. So this is the presence of a third-year emergency medicine, resident. When an emergency patient comes, if we can treat them here, we do it on the spot, and if we need to notify another department, we contact them as fast as possible. Got it? Yes. You interns each take a work list from this monitor and handle the items on it. Wow, it's already full. There's a lot of work, so you must be super happy already, huh? Just don't cause any accidents. In the ER, as long as you don't cause trouble, you're average. Yes. For now, Shin Seonhan and Park Sodam will assist OS, orthopedics, and TS, thoracic surgery, when they come down. Oh Youngwon and Choi Jin-ji, deal with the items on the list one by one. Alright, go. Yes. Phew. All morning it's been wound care, blood draws, tests, calling other departments. How many patients have I seen? And I have to keep this up non-stop for a full 24 hours. They said it was a battlefield, and there really is no battlefield like this. So damn. So damn, you got here fast. You were slammed all morning too, right? Yeah. Well, it's the first day, so I guess we'll get closer little by little. Still, it's a relief we made it in time for the cafeteria. I thought I'd be eating cup noodles on day one. Hard type to get close to. But we'll be facing each other for a month, so I should at least try to get friendlier. Why did you only get this little side dish? Want a shrimp tempura? I grabbed two. I don't want it. Where was your first rotation last month? I was in internal medicine. Pathology. Oh, really? How was it? You're Yeonguk trained, right? Do you know Dr. Kim the snake in internal medicine? When he appears, you can hear a rattlesnake somewhere. I don't know. Internal medicine was pretty fun in its own way, but now that I'm in the ER seeing all kinds of patients, it's even more fun. Fun. What exactly is fun about this? Huh. Being trapped in the ER 24 hours a day, never seeing sunlight, getting worked over by patients all day. How is that fun? You have to deal with their blood, pee, and poop, and if you make even a small mistake, they swear at you. Yell at you. Even hit you. I don't think it's fun at all. You don't like doctors' work? I really hate it. Totally hate it. Especially seeing patients utterly disgusting. And the ER is the absolute worst of all. Remember the incident a few years back at our hospital? Incident? The drunk patient who suddenly assaulted an intern. They say that intern was so traumatized they quit being a doctor. Isn't that scary? Why should you have to go through that just for doing your job? That is scary. Sigh. Honestly, I don't get why everyone's so desperate to become a doctor. Even if you work yourself to the bone treating patients, that's the kind of treatment you get back. Then why did you become a doctor? Well. Because my parents told me to. That's all of it. Yeah. She's lived in a completely different world from me, who clawed my way up wanting desperately to be a doctor. Of course there are people who become doctors even when IT doesn't suit them. Just because they had good grades, or because their parents pushed them. In a way, there are even more people who race through childhood and 6 years of med school like that and end up as doctors. I'm not cut out for seeing patients. I'll just get through internship somehow and switch to a department that doesn't see patients. Phew. Anyway, can I try that? Huh. You said you'd give me one earlier. You said you didn't want it earlier. Looking again, IT looks tasty. Nope. Too late, it's closed. Hey. So stingy. Just kidding. Here, you finish it. Hee hee. Thanks. Her personality's a bit unusual, but she's honest and straightforward. It feels like we can get along. That's a relief. ER Week 1 Intern Evaluation Sheet. An intern showed up with an injured hand, so he's not even worth evaluating. If he at least worked hard, that'd be something, but I don't see that either, he's just busy sucking up to seniors. I don't feel even a speck of desire to give a good evaluation to someone like that. Jo Jin-ji, due to injury, can't perform normal duties, poor self-management, insincere. C. Next, Oh Youngwon. Quick on the uptake, decent work skills. But cuts too many corners. B. He slacks off, but he's got good reflexes and works well. At least he acts his age, so to speak. And as for So damn. She's a headache. Royal among royals. Her work ability is lacking. She seems smart, but she keeps making the same mistakes. Lack of confidence. Not a good fit. Maybe both. Can't be helped. Whether she's a professor's daughter or the president's daughter, evaluation has to be cold and fair. Poor at dealing with patients. Poor procedure skills. Appears to lack confidence. C. And last is Shin Seonhan. I still don't have a full. I worried because he was from closed-down Ilwoon Med, but his skills are better than most Yeonguk grads. The thing to rate highest is his diligence. But he doesn't stand out as some obvious elite either. So that's not quite it. It's ambiguous. ER Week 2. Yongwon Hyung. Are these 3 sets of blood cultures done? Those I've got a patient I need to do dressings on right now. I've got 3 culture sets ready there, so do them when you have time. Who's the patient? The grandma in the inner side of section B. Elderly patient. Just looking, it's not going to be easy to find a vein. Hyung, you're dumping this on me on purpose, aren't you? I dunno. Why are you asking things like that? Just do it. By the way, Sodam's been missing for a while. Where'd she go? She went to do an ABGA and hasn't come back. Hey. What the hell? What do you think you're doing? Sodam. You've turned both my father's arms into beehives. How can a so-called doctor fail to get a single needle in for 20 minutes? My father's burning up with fever right now. Sodam, she finally did it. She caused a scene. It's not even her first rotation, drawing blood should be easy by now. Arterial blood sampling. It's one of the most common intern tasks, but it's definitely not something to take lightly. There are countless cases where they struggle to find a vessel, fumble around, and end up getting cursed at by the patient. This is hopeless. Hey, nurse. Nurse over there. Please draw my father's blood. Yes sir, this is an arterial blood test, so it has to be done directly by a doctor. What? A doctor? Someone who can't even draw blood properly is no doctor. A doctor. I'll call another doctor for you, so please don't shout like that and calm down. How am I supposed to calm down right now? We came here because Yeonguk University Hospital is supposed to be so great. What is this? Pathetic. Absolutely pathetic. What's the point of being royal if she can't even handle a simple procedure like that? She needs to get properly chewed out at least once to come to her senses. Excuse me a moment. I'll draw the blood instead. And you are? A doctor? Yes. I'm a doctor. I'm sorry. For patients with a large build like your father, it can be a bit harder to find the vessels. What? Are you calling my father fat right now? No, I just thought of my own father. He's also a big guy. Total lie. In reality, arterial blood tests are often not that affected by body build. There's a term called rapport. It means the psychological bond formed between people. Building rapport so the patient can trust the doctor is a very important step. Sir, that must have been rough. But this is a test we really have to do, so could you sit up for a bit? You're going to do it properly this time, right? If you make my father suffer again, I'll tear this whole hospital down. Yes, please don't worry. I'm still just an intern, so I'm not perfect. Unlike Sodam, who spent her first rotation in pathology, I spent a month in internal medicine building up a lot of procedural experience. First, I need to secure hemostasis on the right side, and stabilize the left arm. Could you press firmly on his right wrist here? Sir, are you comfortable like this? You need to stay exactly still. Damn. No wonder the guardian is angry. They've turned the patient's arm into a mess. The wrist area is unusable. Arterial blood gas. Usually, we puncture the radial artery at the wrist with a needle to draw the sample. Blood vessels in the body are divided into arteries and veins, and the vessels you see under the skin are usually veins. Arteries are located deeper, so you can't see them with the naked eye. That's why you have to feel the arterial pulse with your fingertips and puncture there. You look for the pulse with your fingers, then stick the needle in, but because of the huge hematoma, nothing can be felt. The only option is to go a little more proximal and look for a chance there. This won't be as easy as I thought. Can I do it in one go? Wow, YUJO as expected. Senior, do you have ultrasound in your fingertips or something? Thoracic surgeon Song YUJO. When that person inserted ECMO, they found the vessel without a second of hesitation. How can someone do that? Hand skills. Experience and knowledge. Or just pure instinct. Right, if she could find a collapsing vessel in one shot. I can't be the one who can't even hit a vessel that's pounding under my fingers. The vessel runs here, and the pulse is just barely palpable above. Then the artery must pass between these 2 points. Where are you? Come on out. Please. Here. Sir, this will hurt a little. Please bear with it just once. Artery, please don't run away. Doctor, you are doing it right this time, aren't you? The blood isn't beating up as quickly as I expected. Is the artery really this deep? Again. Please. Got it. All done. Huh. What? It's already over. Yes. You went through a lot just to get this little bit of blood. It hurt a lot earlier, but this time it only hurt at the start and then I didn't even notice the blood being drawn. Wow, this doctor's good. Thanks for your hard work. I should tip the doctor a little. No. You really mustn't. This doctor here is usually very good too, it just didn't go well today. We all have good days and bad days. Right. Anyway, thank you. I feel so relieved now. We even brought the ultrasound because you couldn't find the vessel. The sampling? Just finished it. Huh. How'd you find the vessel? I palpated it by hand. Huh. You handled it with just your fingertips. Wow, not bad. Good job. But next time, wait until the ultrasound gets here. It's lucky you got it in one go, if you'd missed again, it would have blown up. Yes, I'll do that next time. And you, so damn. Sigh. Go to the bathroom and cool your head. Yes. Few look after your colleague from now on. Otherwise she'll end up being treated like a malig. Malig short for malignancy, malignant tumor. Among doctors, it's a derogatory term for someone with a bad reputation in the department, or a colleague nobody wants to work with. Being labeled malig by your coworkers is about the worst thing that can happen. Please take good care of So damn Uni. I feel bad just looking at her. Why? To be honest, she's been having a hard time since med school. She was quietly ostracized among our classmates. Huh. But she's that royal, right? Wouldn't she have been popular? That's exactly the problem. Even the smallest mistake in clinical practice and people would say, you're royal and can't even do that. You're embarrassing your parents. There were a lot of comments like that. So she became more and more timid. I kind of get it. When people are under psychological pressure, they naturally start to slip. Especially someone with a timid personality like Sodam, she's bound to shrink more and more. I get what you're saying, but forget it. I'm barely managing to take care of myself as it is. Hey. So cold. Sure, I can help her out a bit from the side, but everyone has to handle their own work. We're doctors too. I'm worried, that's all. I'm afraid she might make a big mistake. A big mistake, huh? It's possible, but interns can only do so much in the first place. As long as there isn't a mistake that risks a patient's life, the rest of the month will probably pass without major issues. Don't worry too much. In just 1 month of internship, it's not like something huge will. URK. Is it starting again? Hey. Interns. Are you all here? Oh. That's the ER chief resident. In all my time working in emergency medicine, this is a first. Ugh. Same here. To cut it short, all of you are getting a C this month. C. Got it? WH. What? C. AC. AC after only 2 months of internship. No way. That means this is the last year I'll be at Yeonguk University Hospital. Hey, you lot. What the hell did you do? That's impossible. Everyone getting AC. AC means I'm finished. Don't complain. If one person messes up, it's collective responsibility. You should have looked after each other better. Collective responsibility? Which one of us 4 caused a major accident? I'm sorry. I should have taught better. Forget it. Don't even think about shielding anyone. Is this the kind of mistake that can be prevented by teaching? I'm just speechless. A medical lawsuit because of an intern's mistake. What? Wait, what did you just say? Medical lawsuit? This is the worst case scenario. If something like that happened because of an intern's mistake, the entire hospital would be turned upside down. This isn't something that ends with a simple, I'm sorry. Who was it? Who caused this huge accident? No way it's me. It's not me, right? All 4 of you, listen carefully. Especially you, the one who caused the accident. Right, who is it? Who the hell? WH what? Iowa. Damn it. Kia. OOPPA, why are you suddenly acting like that? Of all times, at the most critical moment. AH. No, sorry. It's nothing. If only I knew who it was, I could prevent the accident. Why does this recognition always end like a drama cliffhanger? Who could it be? These 3 people. No, including me, which one of us 4 will cause an accident? Ugh. At least it's a bit quiet since it's the weekend. Echo room, echocardiography room, often empty. I'm going to the echo room to rest a bit. Call me right away if anything happens. Got it? Hyung, did you do the spinal tapping earlier? There were 4 consent forms for patient Kim Tae-jin. You got all of them without missing any, right? Spinal tapping, lumbar puncture. Hey, of course I did. Who do you think I am? Let's not be too obsessive with each other, man. Obsessive, slang for obsessive-compulsive personality disorder. Excessive perfectionism. Youngwon Hyung is unlikely. He cuts corners, but he's not someone who makes mistakes in his own work. Hey, going off to slack by yourself? Let's slack together. No way, man. Don't follow me. Jo Jin-ji is a strong candidate, but the possibility of him causing a medical accident is still low. Because his hand is in a cast, he's only getting consent forms or doing simple checkups for now. Then the most likely possibility is Seonhan. Can we talk for a bit? Huh. I've been thinking. You asked me before why I became a doctor, right? Since I was little, my parents pushed me to study, and I ended up in med school. I never thought about what I'm good at. What I want to do. I just did what I was told without any reflection. But now that I'm actually a doctor, patients scare me and the work is hard. And the scariest thing is making mistakes while treating people. I think I made 5 mistakes today alone. I guess I became a doctor for nothing. I see. A typical model student case who suffered from excessive pressure since childhood. As the eldest daughter in a 3-generation doctor family, she was pushed to arrive at the destination, and when she came to her senses, she realized this wasn't her path. At this rate, she's a ticking time bomb who could make any kind of mistake in the ER over the next month. So, the culprit of the medical lawsuit is Ham-so-dam. What should I do? If I leave things as they are, everyone gets a C. It's most critical for me above anyone else. Don't worry alone. Huh. Even if you make a mistake, the other interns can cover for you. Use me and Youngwon Hyung actively. You help us too. We're colleagues. Let's look out for each other and help prevent mistakes. How about it? Laying the groundwork. If I imprint this in So-dam's mind like this, I might be able to prevent her critical mistake. Seonhan, you're really kind. Huh. None of my colleagues have ever said that to me. Let's look out for each other and help. Those are really grateful words. It's natural for colleagues. What is that? Your whole family is fish. I'm gonna cry. Sorry for laughing. No, it's fine. She's just timid and struggling in early internship. She's not as gloomy as I thought. That's a relief. If things go well, I can prevent the worst situation. When did I last hear words that build up my confidence like this? Shin Seonhan seems like a good person. Good morning. Hello, Dr. Ham at the hospital. Everyone just treated me with the prejudice that I'm royal. Oh. Dr. Intern, you're already here. Yes, hello. Is there anything I can help with? Oh my. The shift hasn't even changed yet and already? There is some work piled up. If you're okay with it, could you see the patient in section B? Yes, I'll do that. What kind of patient? Urethral stricture patient. He had surgery last year, but it suddenly recurred. He's been waiting for 20 minutes but the other doctors are too busy to see him. Wang Jinho. I feel like I've heard that name somewhere. We need to drain the urine from his bladder first. Can you do a CIC? Should I call another doctor? CIC, clean intermittent catheterization. It refers to a procedure where a catheter is inserted into the urethral opening to drain urine from the body. Patients with urethral problems or spinal nerve disorders who can't void on their own need to have urine drained periodically. Otherwise, the bladder will burst. 20 minutes is quite a long time for a urethral stricture patient. The patient's bladder must be full by now and quite painful. Seonhan said we should help each other. If I want to be helpful, I need to gain even a little more experience with patients. No, I'll do it. B7. Is this it? No need to be nervous. I learned all this in school. Sorry to keep you waiting so long. I'll drain your urine now. No. Way. Mega idol. Next generation K-pop world star prospect. Charismatic rapper. King Gino. Wow. He slays. Yeonguk University Hospital is so famous for its skills that many celebrities. Doctor? Yes. Right now. My bladder is about to burst. Save me. Hey. Listen. Doctor. Doctor. I too, doctor. My bladder's bursting. Bursting. Yes, yes. Pull yourself together. He's not an idol, he's just my patient. Focus on treatment. How are you feeling right now? A world-famous K-pop idol is taking his pants off in front of me. See. Calm down. I'm a doctor and this person is a patient. I'm a doctor and this person is a patient. Doctor. I'm ready. Yes. Calm down. Calm down. That's just. Right, an elephant's trunk, an elephant's trunk. It's not King Gino, it's an elephant's trunk. Doctor. Please hurry. Elephant's trunk. There. Just insert one thin tube into the urethra and connect it to the urine bag and it's done. It's much easier than arterial blood sampling. It'll be a bit cold. Ugh. Maybe because he's a patient with urethral stricture, it's not going in well. Did I put too much jelly on? My hand's slipping. Go in. Got it. It's in. That must have been the hard part. Looks like I passed the stricture. Now let me press on the abdomen to see if urine comes out. Wait, you can't move. KYA. I can't help it either. Erection. I'm sorry, doctor. No. The Nelaton catheter. It went in. Kaya. Sorry. Whose? Where did? What went inside what? So, Dam tried to drain the urine, and when she inserted the Nelaton into K-pop idol King Gino's urethra. I can't even bring myself to say the rest. Hospitals are places where all sorts of things happen, but this is something no one could have imagined. No matter how startled you are, how do you lose your grip on the Nelaton in the middle of the procedure? I'm sorry. Didn't anyone tell you in handover that urology patients often get erections, so you might need to use a Kelly clamp? Even when I do it, that's happened a few times. Ahem. Anyway, you should have anticipated that kind of situation. Yes. Dam has insanely bad luck. Of all days, she came in early today and... She came in early? Dam did? Yeah. Don't know what got into her, but she showed up an hour early. Then this mess happened while helping with something another intern could have done. Wait, then could it be? My encouragement actually backfired. Ugh. To think what I did to prevent a medical accident caused the opposite. What about the patient? They're removing it in the urology or right now. Not just anyone, she sent a Nelaton into King Gino's urethra. This is a disaster. A complete disaster. Then could it be? That King Gino will file a medical lawsuit over this. A lawsuit? Hard to say, but... It doesn't really seem like it. Taking out a Nelaton is a relatively simple procedure, and I heard King Gino kept apologizing, saying he was sorry instead. And seriously, would a world-famous male idol sue because a catheter went into his urethra? The moment he does, he becomes the urethra rapper. That's a relief if so, but still. Tap tap. Tap 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 tap. Why are you so excited, Janji? I'm live reporting the situation in the group chat. Our classmates are going crazy. They say this is a once-in-a-lifetime incident. The Great Nelaton Disaster. Yun SEO, Appa, is Sodam Uni's incident real? What do we do Gunwook, Nelaton, is this for real? Even I've heard about it already. And is that really that King Gino? It's because I said that stupid stuff to her. I'm an idiot. I'm someone who should never have become a doctor. Moron. Dummy. Sniffle. I don't care. I'm already ruined. This won't do. At this point, it's going to be 24-hour close monitoring. If you ever need help, call me anytime. I'll come running to help you, okay? Shin Seonhan. You're too kind. Why are you doing this much for me? Could it be that you? If you make another mistake, I'm done for. If I want to survive at Yeonguk, I have to prevent a worst-case medical lawsuit. Whoa. This is insane. A Bentley really sounds different. So sick. Hey, are you sure this is okay? Taking your dad's car out like this? It's fine. My dad has so many cars he won't notice if one or two disappear. But do you even have a license? You idiot. What kind of 10th grader has a license? Say something that makes sense. As long as you know how to drive, who needs a license? Hey. Step on it. I want to see how fast it goes. Okay. Let's go. Hey, everyone out of the way. Let's go. Hey, slow down. I'm scared. Don't worry. People move aside on their own when they see an expensive car. Step on it. Why's it suddenly pouring rain like this in spring? It's raining outside now. You didn't know. It's coming down hard. Didn't even get to see cherry blossoms this spring, they'll all fall off. Being stuck in the ER, I had no idea what the weather was like. Ha. Oh youth, poor youth, spring's passing and you don't even know it's raining or the flowers are. Thank you for your hard work, everyone. LGH. What the heck is this? You psycho. Why would you bring Hwantor soda here? Oh. Right. If the patients overflow today it's all your fault, you hear me? Got that? Yes, Yeonguk University Hospital Emergency Medical Center. Sorry. Ata. Traffic accident. What's the location in ETA? What's the condition of the patients? How many? 7 people. Hey, everyone move. Let's go. Drive slower. I'm scared. Don't worry. People move out of the way when they see an expensive car. Step on it. Hey. Hey. You're going the wrong way. Ha ha ha. Floor it. Whoa whoa whoa. Screech, screech. Crash. K-crash. Ugh. AH. I almost died. Ugh. My neck. Man. We only survived because it's a Bentley. I seriously thought we were dead. Guys. Look over here. Ugh. Af. Somebody help. We're screwed. What do we do? Chanel. What do we do about this? Damn. It's completely wrecked. My dad's gonna kill me. Underage drunk driving. Those idiots kids these days must have a death wish. So how many patients are there? 7. Fortunately, none of them need CPR. 7. This is the first time this many have flooded in at once. The more critical the patients, the higher the chance of mistakes. There might be a medical accident today. Isn't this our first time in a full-on blockbuster situation like this? It's a good opportunity, so I should learn as much as I can. Youngwon Hyun will probably be fine. Dam is still worrying. But what about Jo Jin-ji? Hyung, what about Jin-ji? What's he going to do with trauma patients when he can't even use his hand? He'll just get consent forms. That's a relief. Right. It's better not to have someone who could snap and cause. NEEOW. 11 top patients just arrived. What? I thought it was 7. They sent 4 more. WH. What do we do? There are already over 10 patients waiting. Apologize and ask the non-urgent patients to wait. Interns, follow me. What's the patient status? There's one level 2 patient, but it's not certain. Most are level 3 to 5. Things are chaotic at the scene, so they might have been triaged wrong. If they come in as level 1, move them straight to the resuscitation room. In emergencies, patients are graded by severity. Level 4, mild pain. Level 5, wound care, simple prescriptions. Level 3, mild breathing difficulty, moderate pain. Level 2, major trauma, moderate respiratory failure, severe pain, or high fever. Level 1 patient just arrived. What? They said level 2 when they left. I knew this would happen. Level 1, cardiac arrest, shock, unconsciousness. In other words, a level 1 emergency patient must be treated first, above all else. Oh, crap. To the resuscitation room. What's the patient's condition? When we arrived, the patient was already drowsy. They've lost a lot of blood. Drowsy, semi-conscious, confused state. We controlled the bleeding initially, but there must be other bleeding sites. EKG looks okay, but saturation won't stay up and blood pressure is only 85. Saturation, oxygen saturation/intubation, tube insertion into the airway, prepare for intubation. Shin Seonhan. Ham so damn. Find the bleeding site. Yes. The most important thing in keeping an emergency patient alive is oxygen. And the second most important is preserving blood. If blood is lost at 1 cc per second, then in 15 minutes nearly 1 liter is gone. For every minute delay in hemostasis, the survival rate drops by 3%. So we have to find the bleeding point as quickly as possible. Found it yet? I'm looking. Where is it? It's hard to stay calm and think clearly in such a tense situation. Found it. Heavy bleeding from a laceration on the left arm. Apply pressure and stop the bleeding. Yes. Her movements are sharp and quick. So damn might actually be strong in big crises like this. Pupils look okay. Ultrasound, I'll check that. Nothing obvious on ultrasound. No pooled blood in the heart, abdomen, or chest cavities. Okay. ABGA results aren't back yet. I'm doing it now. Why so slow? Are you going to finish after the patient dies? What's with him? It's his first time with a patient bleeding this heavily, but still. Move aside. We need it anyway, so I'll put in the A-line. A-line, a plastic tube inserted into an artery to continuously monitor BP and do repeated ABGAs. Here, hurry and run this ABGA. Why yes, sir. Kid. What do you think you're doing? Get a grip. I'm sorry. This is bad. In that state, it wouldn't be surprising if he made any kind of mistake. Seonhan, thanks. Give that to me. He's completely out of it. Good at cutting corners, but especially weak under pressure. He was already tense, then got yelled at by the attending and went straight into panic. I'll go run the blood test. Please keep an eye on the bleeding here. No matter what, I have to prevent any mistakes today. To do that, I just have to move even more. The results are out. Hemoglobin is 6.8. RBC count is way too low. Low red blood cells in the blood is a warning of additional hidden bleeding. Doctor. Then. It's internal bleeding. There's another bleeding site besides the visible ones. Since it can't be seen with the naked eye, internal bleeding is harder to catch than external bleeding. If a critical organ is bleeding internally, the patient's life is in danger. Since it can't be seen with the naked eye, internal bleeding is harder to catch than external bleeding. If a critical organ is bleeding internally, the patient's life is in danger. 1L plasma solution going in, full drip. Call the blood bank about the 3-pack RBC transfusion order and tell them to send it up quickly. When is the portable X-ray we called for getting here? Portable X-ray is here. See spine, chest AP, pelvis AP. Take them quickly. Got it. Everyone step back. Doctor? Just take them quickly. The patient's about to die. You worried about radiation? Nurses and interns, go outside. Normally when taking X-rays, you're supposed to wear protective gear or move far away because of radiation exposure. Shin Seonhan. Why aren't you going out? I'm fine. You get radiation just from flying on a plane anyway. Consider it a trip to Jeju Island. Hey. Man. Is this really the same thing? Right now we need to preserve every drop of blood leaking from the patient's body. I'm not doing this out of some sense of sacrifice or duty. It's not something that grand or noble. Just, immersion. I simply want to focus on what I need to do right now, in this moment. Imaging complete. It's the pelvis. The pelvis fractured and twisted from the impact of the accident. In this case, internal bleeding can reach up to 2,000 milliliters. Get the pelvic binder and contact OS. Yes. Pelvis compressed. Fluids and blood going in. Blood pressure rising. BP, pulse, and oxygen saturation are all in normal range. Patient consciousness? Not yet. I think the patient's regaining consciousness. Phew, we're past the critical point. Professor, vitals are stable. Should we proceed with CT? Yes. And don't forget to continue the transfusion. Understood. Start with brain, then do chest, abdomen, pelvis CT and get the readings. I'll go check on the minor patients outside. Yes, Professor. Phew. Thank goodness. No medical accident. If panicked Youngwon Hyung had caused an accident or mistake, the delay in discovery could have endangered the patient. Like a snowball rolling downhill, even a tiny mistake can lead to catastrophic results. Anyway, it's fortunate we treated the most critical patient safely. Oh. Wait. There are still 10 traffic accident patients left. I don't know where or what kind of problem might arise. At least until tonight's over, I can't let my guard down. Ugh. Doctor, it hurts. Af. Doctor. Please look here quickly. Look here too. Ugh, hi. It's a total war zone. With doctors from orthopedics and neurosurgery coming down, the ER is packed with people. Plus late arriving guardians flood in, turning it into total chaos. This is the moment I finally understand that the ER is the hospital's front door and front line. Phew, so hectic. Yeah. This is truly a day for the record books. I don't think I've had a day this crazy since starting my internship. It really woke me up. Really? Seeing people get hurt and brought in, all my whining until now seems ridiculous. But you're doing well without mistakes. Like when you quickly found the patient's wound earlier. Thanks. It's because of you, Seonhan. What you said helped a lot. Huh. I see. You don't hate seeing patients anymore. No, I still hate it. It still scares me. But still. I have to do what needs to be done. I don't need to worry about SODAM today. Hey. Who's in charge here? Damn it, get the ER supervisor out here. Aren't you coming out? Sir, what's the matter? Are you all neglecting your duties or what? Excuse me. Can't you see my son is injured right now? Why aren't you treating him immediately? That's the kid. The unlicensed high schooler who caused today's chain collision. I heard from the paramedics when they came in he's not even hurt but lying there like that. So that's the student's parent? This whole mess happened because of whom? And he's acting so entitled. You know who I am. Get your supervisor here right now. Yeah, bring them here fast. Otherwise I'll sue all of you for negligent treatment. You can't yell in the ER like. How can I not yell? My one and only son is in pain right now. There are more urgent patients right now. What? Well, for people like that, there's no real difference whether you treat them early or late, right? Shouldn't you do the treatments that finish quickly first? What? Forget you. Call the ER supervisor. Get me a doctor. Ah. Security. Someone call security. Stop it. Angry Ham. I mean Ham SODAM. And who are you? Your kid isn't the only precious one, sir. WH. What? Everyone here who's hurt is someone's precious child. And one of them almost died from losing too much blood. Because of your son sitting right over there. These people should be groveling in apology, and what are you doing right now? This. Of course your son will be treated soon too. So please wait your turn. You. How dare you talk back? SODAM. Emergency Medical Services Act, Article 12. Anyone who assaults, threatens, or obstructs emergency medical personnel through deception can be sentenced to up to 5 years in prison. WH. What? What? What kind of hospital is this? An intern daring to threaten a guardian? Hey, do you know who we are? I'm officially filing a complaint with Yeonguk University Hospital. Yes, please do. File the complaint. What? I'm telling you to file it. My name is Yeonguk University Hospital intern. Ham SODAM. Just you wait. I'm not going to let this go. Please don't let ITGO make sure you do file that complaint. And since you're disrupting care, please wait your turn. We'll see your son when it's his turn. Wow. That was so satisfying, Ham SODAM. So she had that side to her too. Are you going to be okay? He really seems like he'll file that complaint. I don't care. Let him try. I've never backed down just because of connections in my life. The dignity of Yeonguk Royal. Ham so damn. What's with all the yelling in the ER? There are patients everywhere. We're sorry. Hurry up and get back to your patients. Nice. Alright, move it. We've got a mountain of work. Okay, all done. You can go home now. Thank you. Phew, finally a breather. You've seen all the TS patients, right? Yes. Thank you for your hard work. This hospital is really dynamic. I didn't realize it back on the internal medicine ward. Of course. It's called an emergency room for a reason. Patients cry out in pain, guardians shout to be seen faster, and people who look like they're about to die get rushed in. But there's a kind of thrill here you don't get on other wards. Saving a dying patient with your own hands, and sending them back to their families. Changing people's fates. That's the pride of US in ER, emergency medicine. Changing fate. What, did that move you? Interested? Want to stake your career here while you're at it? I'll look after you real nice, huh? Honestly, I'd be grateful to be accepted anywhere. In my position at Yeonguk, I should bow and say yes to any department. It would be an honor to work with you, Dr. Yeo. I'll seriously think about it. Enough already. I don't need lip service. Gak. I mean it, though. Anyway, hurry and go see the rest of your patients. You're way behind. Yes. After the storm swept through, the ER somehow looks unusually peaceful. Even though this is just a normal ER scene. But what is this? This nagging feeling like I forgot something. Yongwon Hyung. There's a big backlog of regular ER patients, right? We've finished with the Ta cases, so let's split them and clear things. Thanks. Lifesaver. By the way, looks like Joe Jinji saw a bunch of other patients while we were handling the Ta cases. Huh. Jinji did? I thought he couldn't do anything because of his hand. Says he recovered faster than expected and already had the cast removed. Ah, it's been a while since I got to do procedures. This is fun. You bastard. You must have been having an easy time while we were dying out there. Hey, come on, Hyung. I've been working hard since the moment they took my cast off. Got it. That's what this bad feeling was. I was so focused on the flood of top patients I didn't even think about the pre-existing patients. Joe Jinji. Nothing he handled seems like a particularly difficult or risky treatment, but thoracentesis. Thoracentesis itself isn't extremely difficult, so an intern can perform it. Joe Jinji. Did you make any mistakes while seeing emergencies today? What? Why are you picking a fight out of nowhere? Just asking in case. Hey, I was called an ace more than once during clinical rotations. I handle my own work. Mind your business. Post-procedure X-ray. You took one after, right? Of course I did, obviously. I just haven't checked it yet. What? Checking X-ray after draining pleural fluid is basic, absolute basics. Seriously. You think you're the only one who worked hard? I was busy too while you were handling top patients. That's something you can push back a bit, isn't it? This feels bad. Open it. Now. Open what? The X-ray. You're annoyingly persistent. Fine, I'll check it. Huh. What the? The pleural effusion is still there. No wonder hardly anything came out when I stuck it. Should I try again? Whoa. Joe Jinji. Don't you see this? See what? There's a pneumothorax this big on the opposite side of the fluid. Huh. You clearly treated the right lung, but the left has a pneumothorax. You don't mean. You punctured the wrong lung. Where's the patient? Which section? If he punctured the opposite lung, this is worst case. He put a hole in the only lung that was still working. W8. Seonhan, if this gets out my intern evaluation is done for this month. What? I've already been getting side-eyed for having my hand in a cast. Can't we just let this one slide quietly? This bastard. What did you just say? The pneumothorax is small so. Maybe we can just leave it alone. Hey, you crazy idiot. Your intern score doesn't matter right now. The patient could die because of you. Where is the patient? It's already been 30 minutes since the X-ray was taken. Ha. Ha. D. Doctor. My. I can't breathe. Oxygen saturation 73%. This is more serious than I expected. The alarm was going off, but I guess no one heard it over the chaos in the ER. Prepare O2 with a facial mask here. Jo Jin-ji. Don't just stand there. Show the X-ray to Dr. Yeo Bongcheol and contact thoracic surgery. Got it. Was this it? The future I saw in my dream. If we'd been even a moment later, there would have been no time to act and the patient would have. Let's think. What can I do right now? The patient is currently suffering from a pneumothorax. A pneumothorax is a condition where air exists inside the thorax where it shouldn't be. To help the lungs breathe properly again, the right answer is to remove the air immediately. Groan. The way to remove the air is needle aspiration. Bring me a 16G needle. Yes. Needle aspiration, the process of quickly removing air from the thoracic cavity by inserting a needle. Here it is. W8. Is it right for me to be doing this right now? I learned about it in textbooks, but I've never actually done it on a patient before. Shouldn't I wait until a more experienced doctor arrives? If I judge this on my own and mess up the procedure, I won't just fail this month's evaluation. In the worst case scenario, I could end up being the one sued for medical malpractice. Gasp. 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 But there's no time. Since he's elderly, there's no telling what will happen if this state continues even a second longer. No matter how fast they hire, it'll take at least 10 minutes for thoracic surgery to get here. If I don't do something right now, it'll be too late. Inserting the needle. Above the nipple, into the top of the rib. It's still shallow. A little deeper. It worked. Oxygen saturation is back up to 89. I saved the patient for now. Hey. Dong Siep. Yeah, get over here right now. It looks like we'll need to put in chest tubes on both sides. Seonhan. What the hell do you think you're doing? Are you out of your mind, kid? Who gave you permission to perform emergency first aid? The oxygen saturation. It went up. Give me a 3-way valve and a 50cc syringe. Here it is. Seonhan. Hold the valve. Yes. Sir. How are you feeling? My wife went out for a moment. Suddenly, I was so out of breath. I thought I was dying. I couldn't even make a sound. You'll be okay now. Don't worry. Honey. What happened? That was a close call. A patient almost lost his life because of a ridiculous mistake. Thank you. I really thought I was a goner because I couldn't breathe. But I feel so much better now that you doctors looked at me. Thank you. Bong Si-joel. Oh. Dong Siep, you're here. Thoracic surgery resident Ma Dong Siep. Good work. We'll take it from here. Sure. I'm counting on you. Hey, interns. All of you, follow me. This is the first time I've ever seen such a pathetic mistake in the ER. You lot call yourselves Youngji UK interns. And you mix up the left and right on an X-ray. You absolute at $% yes. Out of the 4 of us, Jo Jin-ji was the only one who messed up. But in a situation like this, it's better to stay silent. Anything we say will just sound like an excuse. That patient's other lung was already filled with fluid and not even functioning. And you went and gave him a pneumothorax on the good side? Did you even check the X-ray properly? Pneumothorax, a collapsed lung. Were you trying to kill the patient? Are you lot killers or doctors? Well. Apologizing to the patient is a given, but now I can't even hold my head up in front of thoracic surgery. What the hell were you thinking, embarrassing us like this? Sigh. Jo Jin-ji. Yes. Yes. Don't you dare get cocky just because you got your cast off. For the time being, just go back to taking consent forms. Got it? Why yes. Dismissed. Seonhan, stay back for a second. Huh. Why me? I'm sorry for acting on my own. But I judged it to be a critical emergency. Explain yourself. Pardon? Explain exactly how it was an emergency. Be specific. I learned that a pneumothorax can cause cardiac arrest if it is not promptly treated with aspiration. And by the time the pneumothorax was identified, over 30 minutes had already passed. When I arrived, the patient's O2 saturation had dropped to 73%. It was critical. Furthermore, the patient was elderly. I believed we couldn't wait a second longer for a senior whose lung function was already weak. You did well. You caught someone else's mistake and performed the emergency measures perfectly. You deserve endless praise, far more than any scolding. But don't forget that you're still an intern. From now on, never do anything you can't take responsibility for. Don't get cocky and judge things on your own as a mere intern. Got it? Yes, sir. Go back to work. Seonhan. You're getting the top score this month. A.H. The chief and the professor give the final scores, but with my comment, you'll have no problem getting an A+. What's with that face? Are you unhappy? No, it's just. I didn't think you'd tell me that directly. Geez. The weather is so gloomy. It's the perfect day to be stuck in the ER. What are you doing? I told you to get back to work. Yes, sir. I did it. In the end, I changed the future with my own hands. I saved the patient and even secured an A+. What did you say? What exactly did you do to my father? You're saying you punctured his healthy lung and put him in danger. Is that how this hospital operates? We are very sorry. It was entirely our fault. How are you going to take responsibility? This is grounds for a medical lawsuit. Enough. They said it was chaotic because of the traffic accident. Father. Still, he almost. Is that him? The guy who couldn't tell left from right on an X-ray and embarrassed our whole department. He'll go on to say that the heart is on the right. How did he even pass the licensing exam? Zhou Jinjiai. A word with you. Sir. Consider yourself lucky. This is an incident for which we would have no defense if it went to a medical lawsuit. I really want to punch you in the face, but I'm holding back. Instead, you're getting the lowest intern evaluation this month. What? The lowest? But why? If you think about it, SO-Dam made far more mistakes than I did. Of course, doctors are human and can make mistakes. The problem is what you did afterward. As soon as SO-Dam realized her mistake, she contacted other departments and took responsibility for the patient until the end. But you didn't even try to do the basics. What do you mean? You actually told Seonhan to just ignore it and move on. While leaving the pneumothorax alone. Did Shin Seonhan tell you that? The nurses nearby heard everything. I hear you had good grades back at Yeonguk UK. But IT doesn't matter how well you did in school, IT means nothing here. By my standards, you're a 0-point doctor. It's still early in your internship, so you have chances to get good scores in other departments. Use the remaining time to reflect on yourself. So, did the settlement go well? It turns out the daughter-in-law was a lawyer at a pretty big firm. It really could have gone to a medical lawsuit. Ugh, that Zhou Jinjiai. Just thinking about him makes my blood boil. Does the M department not train its interns properly? Look at you. I'll be watching closely to see how well the interns trained in thoracic surgery do. Anyway, the interns have put us through everything this month. First the Nelaton incident with Ham SO-Dam, and now this. Still, it's such a relief the patient is safe, right? It was close. What would we have done if he'd actually gone into arrest? For such a huge mistake, we managed to mitigate the damage well enough. By the way, Bong Chol, your intuition was sharp. What are you talking about? It was a great call to perform the emergency needle aspiration. The ace of emergency medicine truly lives up to the title. It wasn't me. One of our interns did it. Huh? An intern? Come on, don't lie. How could a 2-month OLD intern? I'm serious. He came over from internal medicine last week, and he's got real skill. Internal medicine? Oh, come to think of it, an intern from internal medicine last month. What are the Dongbong brothers doing gathered here? BOMSU. What was the name of that intern who had the ECMO prepped in advance last time? Shin Seonhan. Why? How was that Shin Seonhan? Wow, He's really impressive. I guess he's doing well in emergency medicine too. Shin Seonhan, huh? First with last month's patient and now this. He's definitely not ordinary. It's still too early to judge. Twice could be a stroke of luck. But if this happens again, I'm getting more and more curious to see just how useful he is. Bubbly bubbly. Tap tap tap. Chi 3. Honey, please take out some plates from there. Yeah, got it. I came home after 2 months since starting my internship at Yeonguk University. Oh my. Seonhan. You're awake. Yeah. Nuna. What time is it? Just past 1. You must be really tired, huh? My eldest sister, Shin Seonhan. To me, she's like a mother and an angel. Ugh. Hey, doctor. I thought you were dead. You came home after 2 months just to sleep. It'll be sunset soon. I worked all night and came in the morning, you know. My second sister, Shin Seonhan. She's just a demon. Uncle. Why are you just waking up now? You're supposed to play with me. Yuna. Have you been well? Oh, brother-in-law. You're up. Long time no see. Brothers-in-law. How's hospital life treating you? What kind of hospital makes you only clock out after 2 months? Isn't that a labor law violation? They don't beat you to enforce discipline or anything, right? You don't have any bruises? I'm fine. I just couldn't come because I was busy. You woke up right on time. Let's eat together. Where's Dad? Ha. Let's eat. Thank you for the meal. Oh, so you're saying you ranked first this month, brother-in-law. So does that mean you're becoming a Yeonguk University doctor now? I'm still an intern. If you're an intern, isn't that basically done? At our company, they usually make you a full-time employee. An internship at a university hospital is literally just training. A lot of people go to another hospital to become residents after a year. Still, I'm glad you're doing well. It's all thanks to that tuna eyeball liquor I got for Seonhan before his first day at the hospital. Oh no, not at all. Father-in-law, that day I brought that rare deer blood liquor. Oh ho, what are you saying? That Tijasm liquor I went through so much trouble to get. 1 week before my first day as an intern at Yeonguk University. SSO. You want me to drink this right now? This is that legendary golden tuna eyeball liquor. I saved it to give to my son on a special day, so down it in one shot. No, I don't want it. It's full of parasites and turned yellow from environmental pollution. Hey. You brat. Do you know how rare this is? Drink it already. Brothers-in-law. Please stop, Dad. Golden tuna eyeball liquor. Brother-in-law. If you're going to be a doctor, you need to stay healthy. This is deer blood liquor made with raw deer blood. That's right. A doctor has to be healthy to take care of patients. This was brewed with Tijasm grown at the foot of Mount Yiri. Here, try it, brother-in-law, drink it, son, try, I don't. Grab him. Alright, chug chug. Chug. SS dash. Save. Me. After finishing it all, my stomach was wrecked for days, and I went to my first day of work barely able to move. Come to think of it, my ability to see the future also started after that. There's no way. Right? Wawa it's so peaceful and nice. I wish Monday would never come. A rare, leisurely golden weekend after so long. I can't just waste it meaninglessly. I should hurry and get a little more sleep. So cozy. I feel like I could sleep for about 9.99 million years. Ring Kim Gunyuk mobile phone. Ha. Kim Jiunyuk. Is something wrong at the hospital? Yeah. What's up? Hey, Seonhan. It's bad. Help me out. What's wrong? Did something happen at the hospital? As expected. A peaceful weekend doesn't exist. Our meeting is missing one person. A meeting. Through someone I know, we got a 3-on-3 group date. Youngwon Hyung and another senior were supposed to come, but that senior got caught by his girlfriend. He was going to sneak out and come. Ha. I thought something serious happened. Then just go with 2 people. Hey. How can you do a 2-on-3 meeting? The numbers have to match. And we can't just bring anyone. I get what you mean, but I'm going to sleep. Hey. Wait. Fine. If you come to the meeting today, I'll handle your point for your entire intern year. How's that? Doctors need stamina too. If you go to a gym for this, it's $1,000,000 a month. Yeah. Not buying it. Hey. Seonhan, just come out this once Kim Gun-UK speaker. Do you know how long Youngwon Hyung and I have been waiting for today? We're only going to get busier, so one meeting like this is fine. Our poor Youngwon Hyung. What are you going to do about him? He's already old. How much older will he be next time? Phew. Fine. What time and where? Thanks. Gangnam Station, 6:30. Seonhan, pay attention to your outfit when you come. Ugh, no. I'll just wear something random. I don't even have clothes. For something I threw together in a hurry, it's not bad. Come to think of it, this is my first group date since freshman year of college. What am I supposed to do? It's already awkward. Yo, Seonhan. You're here. Yeah, GUN-UK. We're ready, but are you ready? Young. GUN-UK. What's with those clothes? How is it? I heard wearing white is best to show you're a doctor. They said wearing a doctor's coat too gives a full set bonus. Huh? Who said that? On a doctor community. Everyone recommended it. And what are you, GUN-UK? Is it bad? I asked on a fitness community, and they told me to show off my masculinity. Then what's this? Don't move your chest. It's already ruined. This meeting. We quickly reset everything. Good thing there are a lot of clothing stores around. Do we really have to buy new clothes? The earlier outfits weren't that bad. Exactly. They were totally bad. At times like this, it's not about dressing well, it's about not dressing weird. I'm tired. I want to go home. By the way, they're late. Being 15 minutes late on a first meeting, when they get here, I'm going to say something. Are you from Yeonguk University Hospital? Sorry. We're a bit late, right? We tried to hurry and took a taxi, but traffic was so bad. Jan Tantadan. Haha, we just arrived too. Shall we go? We found a place with a nice atmosphere in advance. She smiled. I'm glad I came out. I've been living so stiffly. Just for today, I'll forget about the hospital and have fun. This is breaking news. Around 9 p.m. tonight, a third-floor terrace of a building near Gangnam Station collapsed, Gangnam Station. Crashing down onto pedestrians passing below and resulting in around 10 casualties, including guests who were on the terrace. Among the injured, one person is in critical condition, and one person has died. It's being reported that illegal parking in the narrow alleys around Gangnam Station made it difficult for ambulances to access the scene. Yes, that's correct. Due to the large Saturday evening crowds and illegally parked vehicles, the transport of patients was delayed. Let's hear an interview with the ER doctor in charge. One patient is currently unconscious due to excessive bleeding, and another died from cardiac tamponade. If emergency treatment had been performed sooner, or if they had been transported to the hospital more quickly. Cardiac tamponade, a condition where pressure on the heart prevents it from filling with enough blood, reducing cardiac output and causing blood pressure to drop. Excessive bleeding. Cardiac tamponade. Dead? A premonition. At a time like this. But they said it was a collapse. If it's Gangnam Station, that's right here. Around 9 p.m. on Saturday evening. No way. That means tonight. Hey, Seonhan. What's wrong? No. It's nothing. Yeah. Probably not. Some of my previous premonitions showed things days into the future. Nice to meet you all. It's my first time drinking with doctors. All the doctors I've met only ever tell me not to drink. Ha ha ha. It's also our first time meeting flight attendants on the ground. If you're from Yeonguk University Hospital, isn't that the best hospital in the country? You must all be really skilled. Oh, not really. We just worked hard. If effort counts as skill, then I guess it is. Ha ha ha. Your ordered appetizers are here. Wow. Looks delicious. Wait. Leave the carving to me. I'm a sausage specialist from Yeonguk University. Oh wow. Ha ha ha. What's your actual specialty? Internal medicine. Surgery. We're still interns, so we don't have specialties yet. I see. We're interns too. For 2 years. But a lot of people quit within 6 months. The job is harder than you think. On long-haul flights, we have to take short naps in the bunk beds. Bunk beds? They're near the tail of the plane, but they're so cramped they feel like coffins. Yeah, and we have to keep our uniforms and hair exactly as they are, and we're so conscious of our seniors watching that even when we sleep, it doesn't feel like sleeping. Wow. That sounds tough. We just close our eyes for quick naps, that's all. But do doctors really stay up for days sometimes? Oh, yeah. Especially when you're doing ER intern rotations, you work 24 hours straight without rest. By the end of a 24-hour shift, you're basically a zombie. Still, there are patients waiting for a doctor's touch, so we always just do our best. Wow, that's really admirable. Hang in there, interns. All interns in Korea, cheer on. Should we order another round of drinks and food? What should we get? Even though I'm searching for bars in Gangnam with terraces, nothing specific comes up. Since it just broke as news, it wouldn't show up on TV or phones in advance. The accident is around 9 p.m. PM 7:55 if it's really today, then in about an hour. This is driving me crazy. Why is my foresight like this? At least tell me the date and location properly. Is something wrong? You've been staring at your phone the whole time. Did you maybe not like US that much? NNO. Sorry. I just got an urgent message. Oh right. Doctors always have to stay on standby, right? I have a relative who's a doctor. Even during his grandmother's funeral, he got a call and ran straight to the hospital. But earlier you said your name was Shin Seonhan, right? Seonhan. Are you really as kind as your name suggests? That's because my family runs a fish restaurant. My father wanted all the fish to always be fresh. Ha 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 ha. What is that? So you're named Shin Seonhan because you're the son of a daughter of a fish restaurant? Then if he had a daughter would she be Shin Seonyo? My older sisters are named Shin Yeonhwan. And Shin Seondio. Pfft. Sorry. I laughed too loudly at your name. It's okay. When I introduce myself like this, nobody ever forgets my name. There's no way I could forget it. But you remember my name too, right? Yes, earlier you said Oh Sujin. Oh, so you were listening. Yes, that's right. Please remember my name too, Dr. Seonchan. Cheers. It's nice meeting you today. Yeah. There's no way it's today. Today I'll just enjoy myself too. Wow, the vibe is great today. I thought they were just pretty, but they're all really forward, huh? I like Yeonwoo. She has such an elegant style. I like Mina. That easygoing vibe is exactly my type. Seonchan, you seem to match well with Sujin. You two never stop talking. Yeah. Are you two a couple starting today? Hee a couple. When would we even have time to date? Okay. Perfect. No overlaps, just right. Operation complete. Let's each support our own target. Where should we go for round 2? What time is it? It's 8:30, so we still have time. How about a wine bar for round 2? It's 5 minutes by taxi. Oh, nice. Wine. 8:30, if it's really today, then in about 30 minutes. Excessive bleeding. Cardiac tamponade. 1 death. What should I do? If it's today. Seonchan, are you okay? You look pale. Are you feeling unwell? I haven't drunk in a while, so the alcohol's hitting me a bit. Haha. That's a relief. Seonchan, take a taxi and... Sujin, where did they say the wine bar was? Taxi. Should we slip away separately? Is this maybe the kind of situation I'm thinking of? Did you plan this with your friends and stayed behind with me on purpose? Yes. I like you, Seonchan. You seem busy, so it might be hard to meet 2 or 3 more times. I want to figure everything out today. What do you think? Yeah. Even if I go, in this huge Gangnam Station area, how would I even know where it is? I'm not even sure it's today. Even if I went to the accident site alone, what could I do? Besides, I'm just a 2-month intern. The emergency treatment I practiced on mannequins as a student. CPR. Excessive bleeding and cardiac tamponade aren't things an intern like me can handle alone. Without any medical equipment there's nothing I can do in the middle of Gangnam Station. Yeah. This is a future I can't change. There are some things you just have to give up. If I try to resolve every problem from now on, my body won't last. And Sujin, who's here right now. She might actually be someone I'm truly meant to meet. Sujin. I'm sorry, but I actually only came today to fill the numbers. I appreciate your feelings, but I don't have the time to date anyone. I'll be going now. Huh. Something really urgent came up. Huh. 20 minutes from now. A third-floor building with a terrace inside an alley. An alley where ambulances can't get in because of illegal parking. If I don't find it, then tonight someone will die here. It seems fine though. Didn't we have an inspection a few months ago? Customers have been saying they've been hearing noises for the past few days. It's fine. It's not like it'll suddenly collapse. Let's call someone tomorrow to check it out. Ha. 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 A terrace. I need to find a bar with a terrace. 5 minutes left. It's impossible to search all of Gangnam Station in 5 minutes. I feel like I'm going to collapse. Was this too much? Was this never something I could do? Should I just give up? It would be easier if I gave up. One of the most important virtues of a surgeon is not panicking in any unexpected situation. No two people's anatomy are exactly the same. Anatomy, anatomical structure and unforeseen circumstances can arise at any time during surgery. No matter how critical the situation, respond calmly. That is the fundamental virtue of a surgeon. Surgeon, a doctor who performs surgery. Think calmly. There must be a faster way to find it. A.H. Street view. Why didn't I think of that? Inside a narrow alley. Around Gangnam Station, there are roughly 3 possible places. But even looking at this, I can't be sure. I'll just go. Where on earth is it? I just can't find it. 1 minute left. Was this reckless after all? Hey. Hey. Bring it on. You think you're that tough? You think you're all that just 'cause you're tall? You crazy bastard. What are you doing? Oh gosh, I'm sorry. I'm sorry. Huh. It must be around here. There it is. Excuse. Excuse me. Yeah. What? What's going on? People are hurt here. It happened. After all. My premonitions are never wrong. Yo Seonhan, where you at? The vibe's great here. Are you having a good time with Sujin too? What? What's happening? Excuse me. Let me through for a moment. Jiun UK. There's no time to explain. Come back toward Gangnam Station right now. I'll send you the location. Huh? What are you talking about? What's this all of a sudden? Don't ask, just think of it like a CPR alert and get here fast. It's an emergency. Hurry. What? The terrace collapsed from the building. Oh my god. Excuse me. I need to get through. Who are you? I am a doctor. I'm a doctor. A doctor? He says he's a doctor. Thank you. It really. It hurts. My leg. Oh my god. What do I do? What should I do first? Stay calm. Do what you learned. First, report it. The person in blue. Please call 119. Yes. Why yes? In situations like this, it's faster to point to a specific person rather than addressing a vague hello. This is Gangnam Station, there's been an accident. There are 9 patients in total and some are critically injured. 9 patients. Some are critical. 119 has been called. Next is the fast, immediate way to assess emergency patients. A. Airway. Is the airway clear? B. Breathing. Are they breathing properly? C. Circulation. Is the heart beating and is blood circulating well? It's a fast and immediate method to evaluate emergency patients. Those of you near the injured, please help. If anyone isn't breathing or is struggling to breathe, let me know immediately. In situations like this, everyone wants to help. They just don't usually know how. Now that they know I'm a doctor, they're actively following my instructions. What I need to do now is triage classifying emergency patients. Realistically, I can't treat everyone at once, so I must set priorities with a cool head. Above all, massive bleeding. Cardiac tamponade. The others won't deteriorate to a critical state even without my immediate intervention. I have to find those two first. Aayawiawa. AAGH. My leg. Sir. How are you feeling? Ugh. My leg. Okay. Let's lift this and free your leg. 1. 2. 3. Heave-ho. No, it's too heavy. We'll need heavy equipment for this. Aya. Let's try lifting it one more time. Please step back for a moment. Jiun UK. He's here. The human heavy machinery. NGH. Ha. URK. L. Look at all that blood. If no major artery was cut, there's no way there'd be this much bleeding. Just below the knee. Popliteal artery. Or maybe along the tibial artery. Looks like there's a lot of bleeding from the bone too. Then how am I supposed to control this bleeding? In war videos and such, when someone steps on a landmine, they tie off higher up toward the body to stop the bleeding. So basically, I need to improvise a tourniquet. Got it. The bleeding's slowing down. Jiunwook, this guy fell from the 3rd floor, so there might be other bleeding sites inside his body. Just in case, let's put on a pelvic binder too. Pelvic binder? Pelvic binder, medical pelvic stabilizing belt. Here, tighten this firmly around his pelvis. I found the massive bleeding patient. Then what about the cardiac tamponade patient? I could see the massive bleeding with my eyes, but this one's not that easy. Cardiac tamponade, simply put, is when blood collects near the heart. There's a membrane around the heart called the pericardium, and if blood accumulates there, it compresses the heart. If the heart can't function properly, it can ultimately lead to death. Ugh. But without an ultrasound machine, how do I identify a tamponade patient? If the tamponade gets bad, they'll lose consciousness, but that takes time. What other signs were there again? Damn it, come on, think. I definitely learned this. 3 clinical signs that point to cardiac tamponade. 1. Hypotension. 2. Jugular vein distension. 3. Diminished heart sounds, Beck's triad. I don't have a stethoscope, so number 3 is hard, but I can check 1 and 2. A few ribs are probably broken and the lungs bruised, but the radial pulse at his wrist was strong, and his neck veins weren't distended. He's not a tamponade case. You'll be okay. Just stay as still as you can until the ambulance gets here. What's that? Taking my pulse. Are you an Oriental medicine doctor? No. Do you feel dizzy at all? I need to use the force of the arterial pulse to find anyone whose blood pressure is critically low. Not this person either. Doctor. Could you please see my friend first? Please. I'm okay. Those bleeding over there look a lot worse off. Okay, how are you? Okay. You took that falling railing straight to the chest. Where did you get hit? My chest. It's a little sore here. Can I lift your shirt? The pulse at his carotid and wrist is weak, and the jugular veins around his neck are engorged. I can't hear heart sounds, but I'm sure. Found it. Cardiac tamponade patient. Now what do I do? Treatment for cardiac tamponade is pericardiocentesis, a procedure where a needle is inserted into the chest to drain blood collected in the pericardial sac. Usually only senior residents can perform it smoothly. And you really need ultrasound guidance to do it safely. I've never done it with my own hands. What am I even thinking? The best thing is to get him to the hospital as fast as possible. 119-foot S here. The ambulance is here. Are you a doctor? Yes. I'm a doctor at Yeonguk University Hospital. We heard a rough description from the caller. You've got a heavily bleeding patient, right? Then we should transport that one first. No. This kid is the most critical. What? He needs to be taken to the hospital right away for pericardiocentesis. Oh. JNWO. J. Ugh. JNWO. JNWO. Stay with me. Phew. What do we do? Heart rate 140. This is bad. We're running out of time. Blood pressure 85 of 60. If we don't treat him immediately, just like in the future I saw, this kid will die. HUUU. JNWO. Take off his vest and shirt. And give me a syringe. Huh. Hurry. If we take him to the hospital it'll be too late. We have to treat him here. The pericardium should be about here. There's no time. I have to succeed on the first try. Hey. Are you out of your mind? What do you think you're doing? Pericardiocentesis. What? Based on what? Blunt chest trauma, hypotension, jugular distension, and look at him sweating cold sweat. There's no time. So you're going to do pericardiocentesis here, with no proper equipment? I have to. If I don't, this kid dies. You crazy bastard. What are you going to do if something goes wrong and you're responsible? Did you forget you're an intern? Quit fooling around and let's get him into the ambulance. From now on, never take actions you can't be responsible for. Don't go making solo calls when you're just an intern. Got it? He's right. I'm clearly about to go beyond what an intern is capable of. Yeah, I'm just an intern. If something goes wrong, it won't just be a lawsuit. My medical care could be over before it even starts. Sob. Doctor. Please save Jean W.O. Hua. But. Hey. Shin Seonhan. From just below the lower edge of the sternum. Aim toward the left. Trust your hands. I've always sensed things with my hands differently than others. These are the hands I was born with. So I can feel the pericardium. Right now, in this moment, the only thing I can trust is the sensitivity in my hands. Flounder, 450 grams. Amberjack, medium size, 4.6 kilos. Flatfish, large size, 3.2 kilos. Whoa, you got it exactly right. At Seonhan's shop, you wouldn't even need a scale, right? Big sis is 56.8 kilos, pig. Shut up. I could measure weight down to the gram just by the sensation in my hands. Flip. Front. Back. I'm going with back. Me too, back. This time it's definitely back. No, it's front again. Hey, are you cheating or what? The sensations I felt were always different from everyone else's. No, I can feel it all with my hands. The hands I was born with were like that. Right now, at this very moment. The only thing I can trust is the sensation in my hands. Don't touch the heart, just pierce through the pericardium surrounding it. Millimeter by millimeter, slowly, bit by bit. The skin layer, then beneath it, the muscle and fat layers. Each time the needle passes through, the sensation changes ever so slightly. And I have to feel when it reaches the pericardium, the shell surrounding the heart. Blood pressure is 75 over 50. Even now, second by second, the blood pressure keeps dropping. Because the heart isn't functioning properly. Stay calm. If I make a mistake and pierce the heart, I'll end up killing this student. That tough membrane tearing sensation. I just pierced the pericardium. 20 cubic centimeters. Once more. One last time. Blood pressure 100 over 70, pulse 100. Ugh. It worked. Pericardiocentesis successful. Jinwoo. Are you conscious? This student's name is Jinwoo. Yes, Park Jinwoo. Contact his parents and explain things carefully so they don't panic too much. Your friend will be okay, got it? GUNUK, check on the other patient's conditions. Yeah, but are you okay? Don't worry. Please head to the hospital quickly. I'll go with you. Alright. You're really amazing. Which hospital did you say you're from? Yes, I'm an intern at Yeonguk University Hospital. What? An intern? Huh. Shin Seonhan. Doctor. This patient was suspected of cardiac tamponade on site, so I performed pericardiocentesis and drained about 60 cc. What did you say? Pericardiocentesis. No, who did it, you? The patient's blood pressure is 90 over 70. Why you? We'll talk later. Even the level 1 infusion pump, get it ready. Call GS and TS right now. What a mess. I haven't even worn these clothes that many times. Ha. Did I do the right thing? What if I accidentally stabbed the heart? If that's the case, what do I even do from here? Ha. You're here too. How's the patient inside? Don't tell me it was really you. The lunatic who did pericardiocentesis on the street. Yes. You did pericardiocentesis on the street without proper equipment. Is the patient your toy? I'm sorry. But how is the patient? Ha. And you're worried about the patient right now? Maybe worry about yourself first. From the looks of it, you must have been drunk outside and pulled that stunt. You poked a hole in someone's chest on the street and expected nothing to go wrong. No way. Did something happen to the patient? If I really stabbed the heart by mistake. It ended well. There's no damage to the heart itself. We also drained the remaining blood in the pericardium. Thank you. Don't give me that crap. So the patient is safe, right? It seems like you're under a serious misunderstanding. Listen carefully. You think you're something special, don't you? You think organizations only hate people who can't do their jobs. Not a chance, doing things no one else does, that's what makes you a malignancy. Malignancy, cancer. You're going to have a hard time working in this hospital from now on. Just wait and see whether I'm right or not. Ha. I'm screwed. Right, the nail that sticks out gets hammered down. That's exactly what an organization is. Seonhan. I'm glad you're safe, doing pericardiocentesis in the middle of the street. I've never even imagined something like that. Anyway, you're the craziest bastard I've ever seen. You lunatic, Shin Seonhan. Yeah. Even I don't know what the hell I was thinking. I heard everything. They say you filmed a full-on medical action drama in the middle of Gangnam Station. That's insane. Wayanseo. How did you hear about it? The paramedics told everyone, it spread everywhere. They said you too saved a lot of other injured people, too. But why go to Gangnam on your day off instead of just getting some proper sleep? I was so worried about the patient I could barely sleep. Huh. Park Jinhwa's name isn't on the ER patient list. If a patient's name disappears from the list, it means a few possibilities, discharged, or transferred somewhere else. No way. Expire. No way. Expired. Deceased. Please, let it not be. Jang Jae-yun Kim Jae-woo Park Jin-woo Park Ji-Yun Kong Hyung-jun found him. Phew. That scared me. He was moved to the ICU. Ma Dong-seop, thoracic surgery. Lung contusion observed on chest CT. Kim Ji-woon, surgery. Internal liver laceration. Observation. So, excluding the heart, there aren't any major issues? Is that him? That's the one. The guy who, right on the street, stabbed a patient in the chest. Hey, Seonhan. Youngwon. I heard the news. What on earth happened? That's just how it went. The internet is in an absolute uproar right now. An uproar. Huh. TTM Politics Economy Society Lifestyle World ITYK Hospital intern, licensed for only 3 months, performs experiment on trauma patient while intoxicated. Settings Nana. What is this? Drunk hospital intern stabs patient in the chest in downtown Gangnam, patient in critical condition. MYT, patient transported to YK Hospital ER, condition reported as severe, recovery uncertain. What is this nonsense? I wasn't drunk. And they're making it sound like I went on a stabbing spree. Lala, holy crap, an intern did that? He's a lunatic lol. I guess he thought he was some kind of god just because he got his medical license. View 2 replies Seondong, Yeonguk University Hospital. A pathetic doctor who treats a patient's life like a fly. You can already tell he's going to be a piece of trash. Crazy bastard. Scumbag. You really are. Something else. You went out for a date, so why did you get involved in something like that? Oh, right. By the way, did you not even exchange numbers with S. Eugene? She contacted me. She told me to make sure I passed this message along to you. Huh. What message? She told you to be careful the next time you board a DXN Airlines flight. Because she might just chuck you right off the plane. Good morning, sir. Hello. Good morning, Professor. Professor Shin Seonhan, Chief of Emergency Medicine. Is this the one? Yes. I don't think our department has any need for an intern who practices medicine however he pleases outside the hospital. Ahem. This is bad. Professor Shin is the type to care deeply about the department's public image. Was this what Kim the Snake warned me about last night? You think organizations only hate people who can't do their jobs? Not a chance. When you do things no one else does, that's what makes you a malignancy. Malignancy, a cancerous cell. Sigh. Was it a mistake? Was my behavior yesterday really that wrong? Did I cross a line I shouldn't have out of arrogance, just because I knew the future? What is going to happen to my future now? Please, show me something. SSO damn. I need to use that, huh? Oh. Sorry. Do you regret what happened yesterday? I don't regret it, but I'm a bit confused about whether I did the right thing or not. There are 18,000 media outlets in South Korea. Don't let it get to you just because a few of them are talking nonsense. You made the best possible medical judgment on the scene as a doctor. I think what you did was brave. She's right. Even if I went back, I wouldn't make a different choice. I chose according to my own will. I just have to accept whatever price I have to pay. Thanks, SODAM. Hearing you say that gives me strength. And I'll try to find a way to help. You helped me when I was having a hard time, too. Seonhan. A word, please. I've got good news and bad news. Which do you want to hear first? I'd like to hear the good news first. I've heard far too much bad news since yesterday. Park Jin-woo's condition improved a lot overnight. Really? Yeah. I heard they're planning on an extubation this afternoon or tomorrow. Extubation, removal of the tube inserted into the trachea. Phew. Thank God. Removing the intubated tube means the patient's condition has improved that much. Now for the bad news. A disciplinary committee meeting is being held tomorrow. That's where your punishment will be decided. I understand. You are really laughing at a time like this? Well, I was expecting it. Better to get it over with quickly. Why did you do it? If you had just stayed quiet for the rest of your rotation, you would have received a good intern evaluation and finished this month without a hitch. Why on earth did you do such a thing? I didn't have a choice. There was an injured person right in front of me. If there was no one else but you to help, what would you have done, sir? Was there any other choice to be made in that situation? This kid. He really knows how to leave a man speechless. I'm sorry for causing you worry. Whatever. Just make sure you have some smooth answers ready for the disciplinary committee tomorrow. What kind of answers should I prepare? How should I know? This is a first for me, too. Do your best. Depending on how it goes, you might even be kicked out of the hospital. Kicked out of the hospital. That would mean my career as a doctor is over. The next day. Professor Shin Seonhan, Chief of Emergency Medicine. Professor Seo Min-suk, Chief of Cardiology. Professor Min Hyung-jae, Director of Educational Talent Development. Professors I wouldn't normally even be able to talk to are all sitting there. Is that person from the hospital's legal team? Is everyone here? Then shall we begin? Wait, the Chief of Thoracic Surgery hasn't arrived yet. Sigh, that guy always gives me a headache whenever he shows up. Can't we just start this without him? Still, this is an issue related to the heart. We can't exactly proceed without him, can we? Oh boy, sorry I'm late. You haven't started yet, have you? Professor Hyo Junim, Chief of Thoracic Surgery. Professor Hyo, are you coming straight from surgery? Oh. How did you know? It's more surprising that you'd think I wouldn't know when you're making it that obvious. Good heavens. I haven't even taken this off yet. No wonder it felt itchy. What an eccentric person. Was there someone like this at YK Hospital? Hyo Junim. For some reason, the name and face seem familiar. Where have I seen him before? But is this the guy? The one who fulfilled every doctor's romantic dream in the middle of Gangnam Station. Pericardiocentesis right in the middle of Gangnam's busy streets. Man, that's every surgeon's fantasy, isn't it? I've always wanted to try something like that once, but never got the chance. And the green intern pulls it off without even an ultrasound. Isn't that seriously impressive? Anyone here ever done a pericardiocentesis outside the hospital? Ahem. Let's hear the details from him directly, and sit down so we can start the meeting. Yes. So professors have all kinds of personalities. My future is being decided right here, right now. Don't panic. If I just explain things honestly, I can make them understand. Intern Shin Seonhan. Is it true you performed pericardiocentesis on the street while intoxicated yesterday? Yes. Damn it. I was so nervous I answered way too confidently. In the middle of a side street at Gangnam Station. Without explaining possible complications. Ignoring the basic principle that a procedure must be done aseptically. Aseptic, no contamination. And you did it relying only on your hand feel? Yes. I had no equipment, so I had no choice. You didn't think to use the portable ultrasound on the 119 ambulance. There was ultrasound on the ambulance. So you didn't know that? No, I didn't. So you admit that, with working equipment available and the patient's life at stake, you still chose to push a risky procedure. If I'd used it, I might have been able to do it much more safely. Yes. Professor SEO, how's the patient doing? As far as we can tell, there were no complications from the procedure. He's currently recovering without major issues. That's a relief, but could there still be legal problems? Under the Medical Service Act, in emergencies you can proceed without consent. Legally, it's unlikely to be an issue. This isn't something we can judge on legal grounds alone. If undertrained interns start doing procedures outside on their own, who takes responsibility? So I can't escape heavy punishment after all. Am I really going to have to leave Yeonguk University Hospital? Still, there's something I'm curious about. How did you know the patient had tamponade? That's not an easy call to make, is it? Can you explain? I used Bextriad as a reference what I learned as a student. On scene, I confirmed jugular distension and hypotension, and his consciousness was dropping. Hold on. Don't you see the same signs in tension pneumothorax? The treatments for the two are completely different. How do you jump to puncturing the heart area without certainty? He's right. In cardiac tamponade, blood fills the sac around the heart. In tension pneumothorax, air fills the chest cavity. Different causes, but similar signs. How am I supposed to explain this? The truth is, I saw the future. Oh. Is that so? So you really can see the future. NGH. Sorry we blamed you without even knowing that. We useless professors. If only it could be solved that easily. The patient had bruising on his chest. Bruising? The falling railing hit him straight on the anterior chest near the heart, causing severe blunt trauma. At first, I did plan to get him to the hospital for treatment. But he went into cardiogenic shock so quickly I had no choice but to treat him on site. Cardiogenic shock, shock caused by heart failure. With no other chest injuries that would cause a pneumothorax, you suspected tamponade first. That's sharper clinical judgment than I'd expect from an intern. And in the end, you saved the patient. What if it was just dumb luck this time? What if the patient had died? But he lived, didn't he? Pardon? We still need discipline to prevent similar cases later. But if you punish him even though he broke no laws. This isn't only about the law. It's about our hospital's stature and authority. You've all worked hard. Vice Director. Vice Director. Sorry to interrupt, but there's an issue we need to respond to quickly. PR strategy will explain the details. We need to get a press release out as soon as possible, and we need that young man's face for it. Why my face all of a sudden? Are they putting me in a news article? Yes. Maybe I did something worthy of criticism, but still. Publishing my face seems a bit much. Criticism? Look at the news right now. You too, intern, check IT yourself. Why yes, sir. Real-time search ranking 1 Gangnam Station intern 2 Gangnam Station fall incident 3 Gangnam Station doctors. TTM, Society, hospital interns who threw themselves in to save patient. Miracle, rescue of a critical case on scene. Comments, 2554, so cool. The future of medical powerhouse Korea looks bright. Ha. I'm quitting my job and going to med school. Which hospital are they from? Truly amazing young doctors. Yeonguk University Hospital. Seems like Yeonguk. That's what a doctor is. Where'd all the people who were trash-talking go? LOL. It was pretty negative until this morning, but once citizens' videos hit the media, public opinion flipped. We should get our own press release out as soon as possible too. Before negative sentiment pops up again. At this rate, our intern will be a national talking point. It'll look pretty ridiculous if rumors spread that we punished him internally. Well, if that's how you feel, Vice Director. Let's hurry then. We need this to hit the media as fast as possible. Then about this meeting. It's probably best if we pretend it never happened. I'm sorry for all the worry. Seonhan. I've heard a lot about you. They say you're diligent, responsible, an excellent young doctor. Sir. The Vice Director is like the sky to an intern. Where would he even have heard about me? Is he just being polite? Thank you, sir. Vice Director Ham Kyung-il. Professor Ham. Kyung-il. Ham Sodam's father. Her dad is the Vice Director. I knew Sodam had strong backing, but her dad is the Vice Director. I heard you've been helping our Sodam a lot during your internship. No, not at all. If anything, I've gotten a lot of help from her. She's a smart and hardworking kid. Haha. I know you're saying that for my sake, but thank you. Thanks for looking out for our Sodam. Alright then, PR team, I'm counting on you. He's going out there with our hospital's name on him, so please take good care of him. I'll look for a way to help you somehow. So that's what she meant. Yeonguk University Hospital. Don't just stand there all stiff, strike a pose. It's your first time ever being in an article. You don't want to look boring, do you? Something that shows curiosity and passion but also looks seasoned. Not too elite, but chic, with that fresh, rookie professional vibe. You know what I mean. I have no idea what she means. Something with bold energy, fitting for young doctors. Then. Like this? Oh. Nice, nice. That's IT. You next to him DOIT too. W whatever, here goes. Oh good, good. Second sister, what is this? Something unholy has sprung from the Shin family. Father, I'm so proud of you, son. Pride of Garrick Market. Big sister, our baby brother looks handsome. Family, and even people I'd lost contact with, are all reaching out. This you? LOL, couldn't you look a bit more normal in the picture? Oh LOL, looking good. Seonhan, I saw it and thought, I know that face. Yo Seonhan, long time no see, how've you been? Kia. The hot-blooded young doctors of Gangnam Station. The true doctors of our time, who risked their lives at a collapse site to save patients. Please sign for US. Knock it off. The internet's been talking about US all day. We're on primetime TV news, and we're topping YouTube and social media. There are tons of hilarious comments too. At 1:15, are we sure that young doctor's face is real? The looks bar for doctors is high these days. There's a cardiac arrest patient at my house, please come quickly. Whoa, X visited Korea. Are those arm muscles for real? Looks like he benches 500 total. Everyone, this is why deadlifts are crucial. Doctors really do need good physical stats. Hey, why are they all guys? Why do I feel like I can smell sweat from the comments? Haha. Haha. Ward 1705. Feeling better now? Yes, thanks to you, doctor. Thank you so much for saving Jean W.O. Not at all. I just did emergency first aid. The ones who saved him were the other doctors. We heard from the attending. They said Jean Woo survived thanks to you. The attending? Who's your attending physician? What was his name? He wears glasses and looks kind of scary around the eyes. Kim the Snake. He grilled me like I'd committed a capital crime, and now he's saying that. Thank you, doctor. I really thought I was going to die. Usually I just play games, ignore my MOM, and go out all the time. I really regretted everything. So, now I suddenly want to become a doctor. My grades aren't that great, though do I stand a chance. What are your grades like? About average in my class. I was way worse than you in middle school. I only made it into med school after finally getting it together in high school. Oh really? JNWO, we're here. Oh. It's that OPPA. Right? You're the hot-blooded Gangnam Station doctor. Whoa. It's really him. Whoa. Let's take a picture together. That's the shot. That's perfect. Doctor, can we use the photo for hospital promotion? Sure, that's fine. Okay, one more time. Our intern doctor is really popular. Are you free tomorrow? Tomorrow? It's my last day in emergency medicine, so I'll be pretty busy. I'll talk to the department, just make some time. We've arranged an interview with SC News. Do I have to? That's a lot of pressure. I'm just an intern, being on TV feels like too much. It's become a national story. You think the broadcasters will just sit quietly? Do it as a favor to me. We haven't had many opportunities to promote the hospital the past few years. Things were at least okay when Professor Baek Ui-shin was here, but since he suddenly retired 3 years ago and disappeared. Professor Baek Ui-shin, the mentor who made me dream of becoming a doctor. Do you know where Professor Baek is now? Huh. No idea. No one knows what he's been up to since he retired. Professor. What are you doing out here? It's still chilly. You still haven't drawn anything. 3rd day now. I will. When? When something comes to mind. Last month you were obsessed with fishing, and now suddenly it's painting. I'm changing trades. At this age, it's not easy to hold something other than a scalpel in these hands. When hands used to holding a scalpel feel empty, I guess they need to hold something. You don't miss the operating table? Not at all. You know you're trending in Korea again. Want to see? I'm not interested in news from Korea. More than anything, the second patient's condition, cardiac tamponade, was very hard to detect. The fact that he recognized it on scene is drawing huge attention. Yeonguk University. Yes, I was lucky. Could you briefly explain how you treated the patient, in a way viewers can understand? The patient was struck by a falling railing and had a large bruise on his chest near the heart, and his consciousness was fading. His blood pressure dropped, and when I checked his neck, his jugular veins were distended, so pericardiocentesis. If it were me, I'd have treated it on site too. It was a decision only a doctor with precise judgment, skilled hands, and above all, real courage could make. It's definitely not something just anyone could do. I judged that taking him to the hospital would be too late, so I treated him on scene. On scene? That young doctor made that call. Finally, one last question. What kind of doctor do you hope to become? I decided to become a doctor because I admired Professor Baek Ui-shin, who once worked at Yeonguk University. In a documentary I saw as a kid, Professor Baek said this: there are 3 things you need to become an excellent surgeon. Eagle's eye, lady's hand, and lion's heart. Someday, I want to become the kind of surgeon he described. Humph. Professor. It's been a while since I've seen you smile. A lion's heart, huh? Doctor, my ring is stuck on my finger and just won't come off. My baby's finger is going to rot, isn't it? Oh dear, you ordered the ring way too small. No. It definitely used to be a size 10 before. Babe, I told you to stop ordering late-night food. What did you say? Yeah, fine, I'm a pig. So why'd you ask a pig to marry you? Don't fight, just hold still for a second. Seonhan, bring that over here. Yes. Seonhan, you hold it tight. Why yes, doctor. Easy. Here we go. Thank you so much. 6 a.m. There probably won't be any more emergency patients now. Today's your last day in the ER, right, Seonhan? You worked hard. Yes. Thank you for everything, Dr. Yeo Bong-si-chol. And about your intern evaluation score, don't worry too much. After that TV interview, the professors cooled off. They won't dock your score. Thanks to the guidance I received from the excellent professors in Yeonguk University Hospital's ER, I was able to save a patient. Still, this time we were lucky it ended well. You can't do that again, got it? Understood? Yes. Thank you for looking out for me. Good. Anyway, wherever you go, make the most of your intern year. Yes, sir. My father once told me, if you compare life in a sail to sailing, there are people who become the tailwind that pushes you forward, and people who become a headwind that blocks your way. Up to now, I've met a lot of tailwind-type people. Will I be able to keep meeting people like that? Did our hospital rent this whole place out tonight? Why are there so many Yeonguk people here? Among younger doctors, this place is like an unofficial hideout. We came here a lot back in med school too. But there is one fatal drawback. Drawback? You can't talk trash about anyone from the hospital here. Yeonguk people are everywhere. Oh, look who it is, our celebrity. You're Shin Seonhan, right? Yes, that's me. Hey, nice to finally meet you. Want to have a drink with us? You're the star of the night. Go around and say hi to people. Thanks, SODAM. Because your dad moved quickly, I avoided disciplinary action. But the secret that your father is the vice director. Hey, this looks fun. Let me join. 25 points. Anesthesia 99 points. M 61 points. Arg. I had just one dart left. I'm going to lose at this rate. Losers pay for everything tonight. Hey, everyone come out. Who? Now. 30 points. I saw your interview on TV. You did well. Thanks. Who? Is this again? But if it were me, I wouldn't have done it that way. First, I'd have transferred the patient to the hospital. If his BP dropped en route, I'd use the epinephrine in the ambulance to keep it up, epinephrine, inotrope/vasopressor, and if needed, I'd do pericardiocentesis at the hospital where it's safer. What's this unsolicited backseat doctoring? Yes, that might have been better. But. Have we met before? Huh. You don't know me. How do you not know me? I thought everyone knew who I was, even non-Yeonguk grads. What is with this guy? Some new kind of attention seeker. I'm Ryu Myung-in. That's a hell of a name. I'm Shin Seonhan. Pfft. His name is Seonhan. That's such a weird name. What do you want to say? Says you can I call you Seonhan Hyung. I'm 24, so I'm probably younger than a 3-time test taker like you. Feel free to speak casually. How about we don't? We're colleagues anyway, why don't we just both drop honorifics? Yo. Excuse me. Did he just cross the line? This type is exhausting. When there's about a 3-year age gap, it's not really right to drop honorifics from the first meeting, is it? There are other colleagues here too. Which department are you doing next, Hyung? ICU. The intensive care unit? That's too bad. I really wanted to work with you, would have been fun to compete. Compete, huh? I get the type. We're all here to learn. What's there to compete over? Heh. Wow. Look at this guy acting innocent. That's the funniest thing I've heard all night. What's with this jerk? Definitely someone I don't want to get close to. Well, we'll overlap on shifts someday, right? I'll be looking forward to it. What is this guy's problem? Poorly socialized. Every word out of his mouth is insanely self-centered. Don't mind Ryu Myung-in. You know him well. He was famous at our school. Known for being a brutal studier. Gold medal at the International Biology Olympiad, IBO, in high school, graduated early from Seoul Science High in 2 years, entered Yeonguk Med as top of the class, graduated top of the class. His nickname in college was Grade Monster. First in the class for all 4 years. He's probably gunning for Intern of the Year this time. Intern of the Year. He absolutely can't stand losing to anyone. Doesn't have many friends either. I don't like that guy. Why not? His vibe is. How do I put it? Just being around him drains you. You'll get what I mean when you deal with him yourself. Still, he's better than that one. Why am I getting the lowest score? Oh boy, he's at it again. Who gave that guy alcohol? Hello. ICU. I'm intern Shin Seonhan. I'll be working in the ICU starting today. Oh, welcome. We finally meet our hospital's top star. You look even better in person than in the photos. As befits its size, Yeonguk has multiple ICUs. They're divided among internal medicine, surgery, pediatrics, neurosurgery, and thoracic surgery. For interns we're assigned across a total of 10 ICUs, and I got the surgical and thoracic surgery ICUs in the cancer center. The professor will be here for morning round soon, so just wait a bit. Okay. By the way, where's the attending? Dr. Byun isn't here yet. If he's late again, he's going to get chewed out by the professor. He really shouldn't be late today. He got ripped apart the other day for coming in after the professor. Oh man, sorry I'm late. The bathroom run took a while. Ugh, I almost died from constipation. Byun Jiwayunam, surgical resident. Dr. Byun, please stop coming late. What if the professor yells at you again? Doctors have to take a good, solid dump too. Seriously. Oh. You're the new intern. Yes, intern Shin Seonhan. Oh ho, so you're the famous Shin Seonhan. I've heard a lot. Really good to meet you. What is this? Unpleasant squishy feeling. Dr. Byun. You did wash your hands, right? Huh. Did I? Can't quite remember. Gaia. WH. What the hell? This doctor. Is he really a doctor? It's so gross. So gross. It's so gross. Good grief. I'm not a kid, why is she telling me to go wash up? I'm all done washing. Oh, okay. There's no point in washing your hands if you do that. What on earth is wrong with him? This guy. Monsieur Young, professor of surgery. Good morning, professor. Hello. Yeah. Hello. Bayan Jiwayunam. Did you get a handle on the patients today? Yes. I think. I roughly did. You. Roughly. Did it? No. Yes. I did it. Ha. Do a better job. I'm losing my hair because of you. Oh, are you the new intern? Yes. I'm intern Shin Seonhan. I look forward to working with you. Oh, right. You're the intern who was on the news recently. You showed a lot of courage and excellent decisiveness. Keep up the good work. Shall we begin the rounds then? Yes, sir. ICU, Intensive Care Unit. If the ER was the front gate of the hospital, the ICU is where life and death are decided. It is literally the place where the hospital's most critically ill patients are gathered. Patients whose condition has suddenly deteriorated. Patients who need the help of a ventilator. Patients who just finished major surgery, patients who received organ transplants, and so on. Because the patient's conditions are severe, there are many issues to discuss. Shall we begin with the patient in room 1? 2 days pod after LAR surgery, right? Yes, sir. LAR, low anterior resection. A surgery performed on rectal cancer patients. EBL was 600 cc during surgery, and 2 packs of RBC went in yesterday. Yes. Hemoglobin is 10.3 today. Serious discussions are exchanged. There are things I don't understand. What was the response from IMS regarding the high creatinine level? Adjust the dose of the antibiotics currently being used. I need to get used to this quickly. Nephrology antibiotics. The rounds for each patient in the ICU are quite long. An average of 15 minutes per patient. It's already been almost an hour. I guess Dr. Bayan Jiwayunam is a doctor after all. My legs are hurting and I can't even focus, but he hasn't even broken his posture while listening to the professor. Snore. Snore. You've got to be kidding me. Is he actually sleeping? Like that? Bayan Jiwayunam, come over here. Ah. What? What's wrong? Oh. It's nothing. You can't set the ventilator settings for the patient in bed 5 like this. Is there a reason you set the inspiration time like this? Why yes. What? I'm asking why you said it this way. Oh, yes. Because the patient roughly looked comfortable breathing. Roughly? You idiot. Can't you see the auto peep occurring? Does that sound like a reasonable explanation? Is that something a third-year resident should be saying? Well. Auto peep, a phenomenon where air remains in the lungs during mechanical ventilation. Auto peep is a problem that can occur if the ventilator is set incorrectly. Auto peep, auto positive end expiratory pressure. If this state is maintained, the patient's lungs will be damaged. Sigh. Forget it, just forget it. What about you, intern? Me? This might be a difficult question for an intern, but how should we adjust the settings to reduce the auto peep right now? Wait. What happens if I answer this right now? If an intern answers something a third-year resident couldn't? What would happen to Dr. Bayan Jiwayunam? What should I do? It would be a problem if I answer correctly. And it would also be a problem if I don't. Well. The respiratory rate. The inspiration time. Oh, and I think one of the pressures needs to be adjusted. I'm sorry. I think I learned it as a student, but I don't remember perfectly. You just listed everything that can be adjusted on a ventilator. Well, fine. That was a quintessential intern's answer. Few success. I'll explain it now, so make sure you learn it well. In this case. Sigh. It's finally over. I had no idea rounds would take 2 hours. Hey, Junior. Oh, yes. It's our first day, but we haven't even had a proper introduction. Do you want coffee? Is it okay for me to be here during work hours? It's fine, it's fine. If you get a call, you just head up. So, what do you want to drink, Junior? Oh, I'll have an iced Americano. Okay. I'll have a grapefruit honey iced tea. Stomp stomp step. Is he telling me to go buy it? Then. I'll go buy them. Oh. You're buying, Junior. I was going to pay. Well, I guess IT can't be helped. I'll enjoy it. This man. AHIT tastes even sweeter because my junior bought it for me. But why has this man been calling me junior since earlier? I'm not even from the same university as him. By the way, I've heard a lot about you. You're not from Yeonguk UK University, are you? Yes. I graduated from ILUN University. ILU University. You mean that trashy school that went bankrupt and disappeared last year? Geez, that must be pretty embarrassing for you. Since your school went under, you can't even tell people where you're from properly. What is with this guy, really? He's just making fun of me to my face. Even Joe Jinji didn't mock me that directly. Actually, I'm from ILUN University too. What? You're from ILUN? I had no idea. After graduating from ILUN, I did my internship at another hospital before coming here. So people don't really know which school I came from. Hey, by the way, did they ever finish the new student hall building? Finish it? It was left abandoned for 3 years before the project was scrapped entirely. I guess the foundation didn't even have the money to pay the final construction costs. There were so many campus couples who got caught making out at that construction site. Not even realizing you could see everything from the 4th floor of the library. Heh heh heh. Heh heh. Yes, you're right. There were a few couples in our department too. I never imagined there would be a doctor from ILUN University at our hospital. Doctor, my ass. From now on, call me senior when it's just the two of us. Other people have seniors and juniors who look out for each other and eat together, but it was lonely not having a single junior of my own. Hey, what are seniors for? I'll take responsibility and make sure you get a good score, Seonhan. Don't worry about this month's intern evaluation. Oh no, what should I do? Half of it is still left. Who is taking responsibility for whom? Intern. This is C03T. The patient in bed 8 has developed a fever. We need a blood culture before changing the antibiotics, so hurry over, please. Got it. I'm on my way. Intern, this is Co3S. We have a catheter removal. The patient is moving to the ward soon, so please come do it quickly. Got it. Damn it. Is this another urgent call? I shouldn't have followed him to the cafe. My morning tasks have really piled up. Senior, I'm heading back to work. My tasks are backed up. Oh, sure. Good luck. Sigh. My back is killing me because I overdid it during rounds earlier. He's a resident too, but he's so different from Dr. Yeo Bongchol. Dr. Yeo Bongchol tried to teach the interns as much as he could from the very first day. IT doesn't look like I can expect anything like that this month. I'm on my own this month. Phew. 10:10 a.m. At least I finished faster than I expected. Intern. You got the handover for Kim Hye-young's bedsore dressing? It's every morning at 10 o'clock. We always do it before visiting hours. That's right. The bedsore. 10 a.m. They said there was one massive dressing that takes 5 people to handle. Yes. I'll be ready in a second. Great. Thanks. Where did they say the dressing supplies were kept? Handover log. An office notebook passed down between interns every month. It's packed with everything from clock-in times and on-call schedules to work guidelines, warnings, and supply management. I'll have to rely on this handover log this month. Gasp. I am really sorry. I wasn't looking where I was going. Are you okay? Nurse Cha Yuri. Nurse Cha Yuri. Ha. I'm okay. I'm really fine. Oh. The passionate Gangnam Station doctor. Are you assigned to our department this time? What are you looking for? Oh, I'm here for a bedsore dressing. Grandma Kim Hye-young. Do you know where the supplies are? Oh. I heard they were in front of bed 5. That's right. Over here. Most of the dressing tools are kept here. Let us know if you run low. We'll restock them from the supply room. And feel free to ask if you have any questions. Yes. Thank you. She's such a lively nurse. Quite a contrast to the atmosphere in the ICU. Kim Hye-young, 74. Grandma, did anything happen overnight? A handsome new doctor is going to do your dressing today. Doesn't that sound nice? Well, shall we get started? Okay. For critically ill patients who are bedridden all day, certain parts of their body are under constant pressure. When the area exposed to that pressure becomes necrotic, the skin melts away and muscle is exposed, causing the patient extreme pain. This is known as a pressure sore. To prevent this, nurses must constantly change the patient's position. Okay. 1. 2. Preventing pressure sores isn't easy, and once they've formed, they only deepen if they aren't managed properly. Heave-ho. Doctor, the dressing, please. Oh no. It's in worse shape than I expected. Just how long has she been lying here for it to get like this? Young Yuen. Just hold on to that so it doesn't get pulled out. Got it? Why yes. Phew. This isn't as easy as it looks. Wearing protective plastic to prevent infection while doing the dressing has me covered in sweat already. I can only imagine how hard it must be for the nurses holding the patient up. But the one suffering the most is probably the patient herself. Grandma, please just bear with it for a moment. We're almost done. What? Young Yuen. Good grief, really? Hold on a second. I am sorry. It's okay. Please give me a new pair of gloves. Why yes. Young Yuen, I'll deal with you later. Eek. I know exactly how she feels. But it can't be helped. If the medical staff makes a mistake, the patient's life is at risk. The ICU is the final line of defense for sustaining a patient's life. Even a minor mistake or a small error in judgment can lead to fatal consequences. I shouldn't be worrying about other people. I need to keep my own wits about me. It's finished. Good job, intern. Yes, good job to all of you, too. You said the patient has stage 2 colon cancer, right? Yes. She had surgery 2 months ago, but there were several additional surgeries due to complications. Then she ended up on a ventilator because of pneumonia. It's metastasized to her lymph nodes, but she hasn't even been able to start chemotherapy because she's in such poor condition. She's been in the ICU for 70 days now. I wonder if she'll ever be able to walk out of here. I'd be so happy if she just recovered enough to move up to a general ward. 70 days. I can't imagine what it feels like to lie there for over 2 months with nothing to look at but the ceiling. Not just her body, but her spirit must be completely exhausted. By the way, is this your second time around as an intern? Huh. You didn't seem panicked at all when the breathing tube came loose earlier. Usually, intern doctors panic when something like that happens. Now that I think about it, she's right. Is it because I've been hardened by all the different things I've experienced? I guess I am growing in my own way. Here we go again. This situation. Expire. Someone has died in the ICU. Who on earth? Is it? Someone has died in the ICU. Who on earth? Is it? Ah. Not here again. Eek. What's wrong, doctor? What are you doing here again? Oh. No, I'm sorry. Surgical ICU. Patient death. In the dream, someone died at night and was carried out covered in a white sheet. I don't know the exact date, time, or who it is. It's not just 1 or 2, there are over 10 patients, and they're all critically ill. In my dream, it was night, and both my senior and nurse Cha Yuri were there. That means it's a night when their night shifts overlap. May 11th and 22nd, a week from now. I need to take the on-call shift on those days. Yes. I'm here to change my on-call schedule. Hey Seonhan. How about a fresh cup of coffee? I'm backed up with calls right now, so I don't think I can go. Oh, come on, Junior. Just take it easy, I told you I'll give you a good grade, didn't I? Let's go after work. Ugh, you old fogey. I hope you go bald. Hello. Hello, doctor. Are you here to find something again? Well, I need to do Grandma Kim Hye-young's dressing soon, but I think we're missing a few tools. Oh dear. We're already out of skin care and Sylvadine ointment. I'll go restock them from the supply room now. May I come with you? I'd like to learn where everything is. Sure. Follow me. Oh, right. Dr. Seonhan. I saw that broadcast again yesterday. Huh. An eagle's eye, a lady's hand. And a lion's heart. You looked so cool on screen, you're quite photogenic. Please stop teasing me. I'm not teasing. I mean it. Sometimes we run out of supplies. When that happens. Like this. From the supply room. If you take it out. It's done. LA. La 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 la. Whoa, you're really tall, Dr. Seonhan. Are your arms just long? Do you need anything else? What was it? Oh, right. I need Silvadine too. Is it that one? Yes. I'm sorry. It's okay. Awkward. Man, his chest is quite firm. Phew. Finished. Whoa. Amazing. You really finished quickly. I think Grandma has something to say. Dr. Seonhan. Thank you. Grandma must really like you, Dr. Seonhan. Thank you. Grandma, hang in there. You'll be healthy again soon. I'll make sure you are treated with utmost care. How is the work? Manageable? It's good that you're working hard, but don't get too close to the ICU patients. Huh? Why not? Just don't do it if I tell you not to. 1 week later. I haven't slept properly all week. I couldn't sleep because I was trying to figure out which patient would die and how. I've considered various complications that could occur post-surgery. Is it myocardial infarction? PTE, pulmonary thromboembolism? Should I just wait for the CPR announcement and act as fast as I can? Or should I just stay up all night in the surgical ICU? I have to change the future again somehow. Who was the person I saw in my premonition? A 23-year-old male patient admitted with multiple trauma and on a ventilator. They said during rounds yesterday that he was recovering quickly. A 54-year-old female patient who had gastric cancer surgery. She has underlying conditions like hypertension and hyperlipidemia, but a stroke patient who's been in the ICU for a month after colon cancer surgery. Could the patient tonight be Grandma Kim Hye-young? Honestly, she's the most likely candidate. Her CT results aren't good either. The colon cancer has metastasized throughout her peritoneum. If Grandma Kim Hye-young's condition becomes critical, what can I do? Grandma. How are you feeling today? Eat well. Yes, Grandma. I'll make sure to eat well. Get well soon so we can go eat something delicious together. Why don't Grandma's guardians ever come for a? But this is a bit much. No matter the circumstances, how could they just abandon a family member like that for so long? Especially when she could pass away at any moment. It's not easy even for family members to. I don't know their family situation, so I'm not in a position to judge. Still, if her guardians visited, maybe Grandma would gain some mental strength. Oh ho. Seon-chan, were you originally on call today? There was a personal matter. So I changed the date. Did you change your on-call shift just to be with me? I'll be in the on-call room, so call me if anything happens. Is he the senior from the future? Dr. Seon-chan, aren't you going down to sleep? Oh, I think I'll just stay here today. To be honest, I'm a bit worried about Grandma Kim Hye-young. I saw her CT results from this morning, and they looked really bad. Dr. Seon-chan, there's something I wanted to tell you. Where is it? Bed 5. Grandma Kim Hye-young. Grandma. Grandma. Please call Dr. Byun Ji-Nam immediately. Her blood pressure dropped to 60. Please trigger the CPR broadcast immediately. Oh. Dr. Byun Ji-Nam. Ms. Kim Hye-young's blood pressure keeps dropping. I think we need to start vasopressors. Shin Seonhan. Stay back. What? Don't do CPR. Don't do anything. This patient is DNR. DNR, do not resuscitate. An agreement not to perform futile CPR on a patient with no realistic chance of recovery. I already spoke with the family on the phone earlier. Doing CPR now will only put her through the pain of a broken sternum. Beep. Beep. So. Like this. I'm just supposed to stand here and watch her die. Dr. Bayan is right. DNR doesn't just mean giving up on treatment. It's also about preserving the patient's dignity and letting them go to heaven in peace. Her heart rate slowed down to about 20 beats, and now it's a flat line. The heart isn't functioning anymore, it's just twitching faintly. For all intents and purposes, she's already gone. Is Grandma's soul still somewhere nearby? MOM. Mother. I'm sorry, MOM. I'm so sorry. Sob. Please don't be in pain anymore. Patient Kim Hye Young, 3:20 a.m. I hereby pronounce her dead. Sob. MOM. My tears aren't coming out. I'm just angry. To know about the death beforehand and still be unable to do a thing. We'll clear the medical equipment. And then we'll let you come back in to see her. Could you please wait outside for a moment? Dr. Shin, remove all the lines and tidy things up. Yes. Seonhan, can you handle this? I can do it if you want. No. I'll do it. The patient has died. Now, I have to do my part. Cut everything inside, remove the lines, and if it's bleeding a lot anywhere, just give it a stitch or two. You don't have to do it perfectly. She's already passed away, so just do it. However, I'll do my best. Fine. Do that. Good job, Dr. Shin. That was your first post-mortem care, and you did it very carefully. Post-mortem care, cleaning and tidying the body. If I'd known she would leave us this suddenly, I would have tried to talk to her at least one more time. She must have been so lonely and scared the whole time in the ICU. I feel so sorry because it feels like I didn't really do anything for her as a doctor. This is the board Grandma used. Thank you, it's alright. Every year, about 300,000 patients are admitted to ICUs in Korea, and more than 40,000 of them die in the hospital, a mortality rate of about 13.8%. It might look simple as a mere statistic. But facing the death of each and every person in front of you is a completely different matter. Dr. Shin. Are you free this evening? I wasn't aware there was a place like this near the hospital. You weren't? The chicken feet here are amazing. When I was a new nurse, the seniors really gave me a hard time. Whenever that happened, I'd come here alone, eat chicken feet, and drink soju. Come to think of it, how long have you been a nurse, Nurse Cha Yuri? I don't even know how old you are. How old am I? 30. A full 30. 30. Oh my, did I look a bit younger? I'll take that as a compliment. Haha. It's already been 3 years in the Yeonguk UK ICU. From this year, I'm even a preceptor for new nurses. Preceptor, a nurse with 2-3+ years of clinical experience who mentors a new nurse 1:1 in work and hospital life. You know the saying, even a village school dog recites poetry after 3 years. It takes exactly 3 years for ICU nurses to really get used to the work. Our ancestors were quite wise. Isn't ICU work hard? Of course it is. There are many new recruits, but no seniors staying behind, so we're short-staffed. The ICU is the department in the hospital with the highest nurse turnover rate. But I don't think you're in a position to be saying that, Dr. Shin. Huh? What did I even do? I saw your TV interview. You said you wanted to do surgery, didn't you? Why are you trying to go down such a rough path on purpose? I wonder. Still, I think you'd make a good surgeon, Dr. Shin. Even if it's just a polite remark, thank you. It's not just a polite remark. I could tell after watching you do the post-mortem care. Nurses can tell just by looking. Whether a doctor has good manual skills or not. And above all, I've never seen an intern put so much care into tidying up a patient who has already passed away. It must be hard for you too, Miss Cha. Of course it is. Usually, I just force myself to act cheerful. Otherwise, I wouldn't be able to bear it. The physical exhaustion is fine. Nursing is hard everywhere, after all. But watching patients die right next to me is hard every single time. But what can we do? It's our job. Nurse Yuri is right. This is our job. I will see countless more patients, and some will die. I'll have to get used to that. Will I be able to face their deaths calmly someday? Oh dear, here she goes again. What? She's out cold after only 3 glasses. She can't even hold her liquor, but she comes here every time something upsets her. Are you her boyfriend, young man? It's the first time I've seen her here with a man. No. We're just co-workers. Co-workers. Oh. It's raining. My first ICU patient, Grandma Kim Hye-young, passed away, and just like that, the spring of May was passing by. Yeonguk University Hospital. Even after that day I've been responsible for several critically ill patients. A patient with pulmonary embolism. A patient with acute viral pneumonia. But before I could do anything, the patients passed away. Even if I knew the future, I couldn't say for certain if I could save them. It's tough. I feel like a boxer who got knocked out without even being able to throw a punch. Doctor. This is the surgical intensive care unit. There's a patient who needs dressing again because fluid is leaking out after today's surgery. Yes. I understand. Oh Taekjung, male 85 years old. Lung cancer surgery. He's quite old. Hello, patient. I'm going to disinfect the surgery area again. Why is he looking at me like that? Excuse me. Are you a medic? You came at just the right time. Take a look at this wound. Medic? Not a medical officer. What a peculiar person. Yes, patient. I will start the disinfection. Why is he acting like this? Are you okay, elder? Keeping an eye on the front. All clear. What is happening? The disinfection is done. I'll be on my way now. Take a detour around the right trench. Oh dear. Looks like this elder is about to meet that person. That person? Judging by the lack of discernment and him talking to himself. This patient has delirium. Air raid warning. Air raid warning. Delirium, acute consciousness disorder. This phenomenon mainly occurs in elderly patients after major surgeries. They may experience hallucinations, delusions, and nonsensical speech. In some ways, it may look similar to dementia, but it's different. Unlike dementia, where symptoms gradually appear, delirium manifests violently overnight. It's surprisingly common, occurring in about 2 out of 3 patients in the ICU. Patient, do you know what year it is right now? 1970. 1970. Oh my God. That was over 55 years ago. No wonder it's been feeling off since earlier. Oh dear. I guess we'll have to stay alert tonight. Night? Usually, these patients' symptoms worsen at night. I don't know the exact reason, but if you go to Nui-ba, be careful in the woods. There might be booby traps. I should change the 4 fluids. Grenade. Mommy. There's a grenade. Everyone, take cover. Patient, you mustn't move. Patient. It's not a grenade, it's a medication bottle. A medication bottle. A grenade. It's a grenade. Whoa. That surprised me. Were you caught off guard? Yes. It's my first time seeing a delirious patient. Hee. But that old grandfather is a bit unique. It's also the first time I've seen someone confuse the ICU for a battlefield. According to the record, he actually served in the Vietnam War. It's true. Seeing that he still suffers to this day, unable to forget what happened 55 years ago. Was the trauma from the war too great for him? But if the patient had a lung cancer operation, shouldn't he go to thoracic surgery? He ended up here because the beds in the thoracic ICU were all full. Why did such a noisy patient have to come to US? What a hassle. Anyway, I'm not their primary physician, so whatever if anything happens, make sure to notify thoracic surgery properly. The fierce Korean tiger, the pride of 50 million people. For freedom under the sky of Vietnam, divided north and south. Gee grandfather, please calm down. The courage to catch even ghosts. I didn't get enough sleep last night trying to calm him down during the attack, and now I'm exhausted. How am I going to handle today? I'm here to disinfect. Oh, hello, doctor. Even though it's early, you're already working hard. Huh? What the? Did you sleep well last night, elder? Oh, of course. Thanks to your care, I slept like a log. I must be a hospital type. Well, you did receive sleeping pills, so you probably slept comfortably. But for some reason, my voice seems a bit off. It sounds a bit hoarse. Maybe because of my age. Hee hee hee. That's probably because you were yelling all night long. By the way, do you know what day it is today? Let me think. Since I had surgery yesterday. Today is May 17th, isn't it? He knows the date accurately. At this level he is almost perfectly normal. It seems the delirium was a temporary state. Yesterday was the first day in the ICU, and his mind might have been unsettled due to adjusting to the unfamiliar environment. Ha ha ha. What? A grenade? Choi Yunsung intern colleague. Don't laugh. The patient will hear you. Since you're on duty today, be careful. He was fine during the day, but who knows what will happen at night. Don't worry, how much trouble could an elderly person in the ICU cause? If things get rough, we can just overpower him. Why Yunsung? Yunsung. What's wrong? What happened? Elder. What happened? Ha. Don't get me started. He suddenly said he needed to pull out a gun early in the morning and ripped out his chest tube. He pulled out the chest tube. Yeah, blood was flowing from his chest and splatterang everywhere. It was the worst moment of my internship so far. He said he had to go to some place and wanted me to cover him. He was holding the chest tube like it was a gun. All the lines were pulled out, and I barely calmed him down with an injection. That was while I held the old man tight, and the nurse beside us barely managed. Ha. It wasn't like that until yesterday. But why is your nose like that? I got hit while trying to restrain the patient. That old man was surprisingly strong. Be careful when you're on duty, too. He must be a veteran, his punches were no joke. After causing such a ruckus last night, he's sleeping so well now. Does the hospital look like a battlefield to him? Does grandfather Oh Taekjung not have any guardians? I feel like I've never seen anyone. That's true. No one seems to be here. A few days ago, a veteran from the association came by. Oh, and he said he's a Marine, right? Yes. It seems his lung cancer is likely due to aftereffects from his service. The veteran who came to. Aftereffects from the war. Vietnam War Marines Oh Taekjung. Huh. He's really here. Speak out. Testimony of a victim of Agent Orange from the Vietnam War. You served as a platoon leader in the Vietnam War, right? Yes. The first operation I was assigned after being deployed to Vietnam was a search mission. Everything went dark. I was just a rookie officer who had just graduated from Marine school. I trembled at the thought that the lives of my platoon members were in my hands. Fortunately, nothing happened in the first month. The platoon members followed well, and the operations went smoothly. But after about 6 months, a few of our platoon members ended up dying. Among them, Private Kim Cheol-woo. He got shot in the face during a search and returned with a hole in his face. He was a young friend who carried a letter from his mother in his pocket. That must have been a big shock. But I had to accept it. That's what war is about. The enemy has probably suffered a lot because of us as well. While others might view war as a badge of honor. For me, it only left horrific memories. I still shoot up from bed in a jolt when I think of those days. Doctor. After the visitors leave, please insert the L tube for the patient in bed 7. Yes. Understood. Ugh, hi. It looks like today is ending without any major issues. I have to go. I need to find our platoon members. As expected. The delirium starts again at night. Grandfather. Please calm down. Let go of me. I have to go. Our platoon members are trapped in enemy territory. Quickly call his attending doctor. He's just an old man anyway. For now, let's overpower him. Huh. K.O. Ugh. Grandfather, please calm down. This is a hospital. Senior. Please help. Have you called thoracic surgery? Yes. Then get the sedative ready in advance and wait. Since he's their patient, they'll handle it themselves. Seriously. Dr. Byun Kyunam. Don't just watch and help us. Ugh. This is so annoying. Old man. Stay still. Dr. Byun. Finished. Let go. I said let go. I have to go save our platoon members. No. If the chest tube gets pulled out again, it will surely have a negative impact on the patient's postoperative prognosis. What should we do? If I can just calm him down for even a moment. Let go. Platoon leader. Please get a grip. Platoon leader. Please calm down. Why you are? Private Kim Cheolwoo. Yes, platoon leader Oh Taekjung. I'm Private Kim. Are you really Private Kim? Yes, sir, platoon leader. I'm Private Kim Cheolwoo. We dodged enemy fire and ran like hell. Everyone made it back in one piece. See? I was right, wasn't I? Sergeant Byun. Why yes, sir. That's right. I, got grazed by enemy fire in a very unfortunate spot, so. You all made it back alive. Yes, sir. The medic will be here soon. Platoon leader, you need to treat that gunshot wound first. Huh? You were shot, sir. Why you can feel pain in your right chest, can't you, sir? The bullet's still lodged there. You mustn't touch it under any circumstances. We need to get you prepped for treatment, so please lie down on the bed. Oh. All right, of course. What's this? I heard it was chaos, but he seems calmer than yesterday. Ma Dong Siep thoracic surgery. Let's take a look. At this point, a dexmedetomidine drip alone should keep him sleeping just fine. Last night we needed Haldol 5 mg once, then 10 mg once, just to get him to sleep. Don't even get me started. Our on-call interns took turns getting punched in the face by him all night. Did he throw punches again today? Then how did you manage to calm him down? On the phone earlier I could still hear him yelling in the background. Our intern here pulled off quite a move. The intern? Oh, you're Shin Seonhan, right? You were in the ER last month, weren't you? Why yes, sir. Sounds like your crisis management skills were impressive there too. Somehow I get the feeling we'll be seeing each other a lot. How about we get along? With delirium this severe, the patients around him must not be getting any sleep either. Isn't he actually supposed to be in the thoracic surgery ICU? Yes. But they said they have no free beds in their ICU. We'd appreciate surgery's understanding. In the ICU, the delirium could actually get worse, you know. True. If it gets any more severe, we're thinking of sending him up to the general ward. But he still depends on oxygen. So for now, we'll watch him in the ICU for another day or two. Well. Alright then. If anything happens, we'll contact you immediately. 2 days later. Air raid alert. Air raid alert. It's starting again. I told you to close the fridge door. It's cold out. Daughter-in-law. The soup's too salty. It's raining. Bring the laundry in. Who ordered jjajangmyeon? Fried dumplings are on the house. Oh boy, what's gotten into everyone all of a sudden? Young-un. Put restraints on the patient in bed for. Yes, ma'am. What the? Why is everyone like this? Is delirium contagious or something? Please. Make these crazy people quiet down. We're trying to sleep in here. This is terrifying. Even the patients without delirium. Are you the thoracic on-call doctor? Please come take a look, quickly. Patient Oh Taekjung transferred to general ward. Ah. That hit the spot. His delirium was pretty bad. Won't he cause trouble on the ward as well? Maybe he will, maybe he won't. He still seems to need oxygen therapy, though. That's their problem. Do I have to worry about thoracic surgery's patients too? Hey, kid. Just looking after your own patients is already more than enough work. Don't worry about patients who've left your hands. The doctors I imagine are people who throw everything they have into saving their patients' lives. But Dr. Byun Gyu Nam is just an ordinary office worker. Or maybe less than that. Someone who wants to dodge troublesome cases and live as comfortably as possible. Why choose surgery of all things? With that personality, there have to be departments that would suit him better. Then why did you become a surgeon, senior? Why a surgeon? I applied to surgery to become a big shot surgeon. Sorry. Why so surprised? Didn't expect that. Ever since I was a kid, TV always made surgeons look so cool. I wanted to be one of those cool surgeons. He's just like me. But now I regret it. You should never become a surgeon. Huh? Why not? You've seen it a bit by now, haven't you? That being a surgeon means spending your whole life seeing patients who might die at any moment. The harder you work, the more your mind gets torn up. That's what this field is like. Imagine a patient you cut open and stitched up with your own hands slowly wasting away after surgery and dying. When that happens, I can't sleep for a week. As you live, you realize it's better to keep some distance from everything. No matter how hard you try, some patients will die anyway. So he's been through a lot too. I judged him too quickly. Anyway, if you still insist on going into surgery after all that, know that I am your future. Yikes. Absolutely not. Becoming someone like Dr. Byun Gyu Nam is not why I came to Yeonguk University Hospital. My role model is Professor Baek Ui Shin. This is the surgical ICU. Grandpa Oh Taek Jung. This is bad. The nurses need to see this. Oh my God. He's pulled out his own endotracheal tube. Father. Father. I never thought you'd go without even leaving a last word. I resented you my whole life. Honestly, I still hate you. But I should have at least seen you one last time. Then maybe I wouldn't have any regrets left. Gah. You scared me. Hey. I know you hate the idea of turning into me, but do you have to scream like that? Grandpa's condition must have worsened, so they intubated him. Then, while in that state, he pulled the tube from his airway himself and ended up dying. This time, I will change the future. Department of Thoracic Surgery. Hello, Dr. Ma Dong-seop. Oh. Shin Seonhan. What brings you here? I wanted to check up on Grandpa Eo Tae Kyung. He's a patient I took care of before, so he's been on my mind. So you came all the way here just to see him? Let's go. I'll show you the way. Oh, hello there, young doctor. Have you been doing well? Of course. You must be busy. What brings you all the way here? You seem to be in a good mood today. As expected, when he's in his right mind, he really is a perfect gentleman. Of course, he completely changes once night falls. I had a wonderful dream last night. A wonderful dream. I dreamed that a comrade who died on the battlefield came back alive. I can't even describe how glad I was to see him. Wait. Could that be because of my acting last time? Did playing along as Private Kim leave a deep impression on his subconscious? It must have been great to see your old comrade after all this time. It feels like a weight has been lifted from my chest. That friend is probably reborn by now and living a good life, right? Getting married, having kids. You should get well soon too, Grandpa, so you can see your family. I have a son. But I haven't seen him in about 10 years. Oh, no. I messed up. If his relationship with his family were good, they obviously would have come to. Come to think of it, I have nothing but regrets when it comes to my son. I couldn't provide anything properly for him, and I even passed down something that should never be inherited. Something that should never be inherited. Cough, cough. Wheeze. Grandpa. Move aside for a second, will you? Huuu. Huuu. Grandpa Eo Tae Kyung is a patient who underwent lung cancer surgery. Because he had a lobectomy via thoracotomy, the pain must be beyond words. Grandpa, breathe in slowly and deeply through your nose to fill your lungs completely, then exhale slowly through your mouth. How is his recovery progressing after the surgery? Are you interested in this field? I'll be rotating through thoracic surgery eventually, so I thought it would be good to learn in advance. The surgery itself went well. The tumor was completely removed. As long as he recovers well, he should be fine for the time being. But you never know when a patient's condition might take a turn for the worse. His lung function wasn't good to begin with, and because he's thrashing around due to delirium at night, his recovery isn't going as well as expected. Then wouldn't it be better for him to stay in the ICU? However, an environment like the ICU can actually worsen delirium. So it's best for him to be in the ICU because of the delirium, but being in the ICU increases the likelihood of making the delirium worse. Is that it? Yeah. That's exactly the problem. Sigh. It's like looking at a snake biting its own tail. It's a dilemma where we can't do this or that. What should we do? Doctor. Doctor. Please look over here. Cough. Cough. What happened? The patient was eating when he seemed to have aspirated. Aspiration. When food passes into the airway instead of the esophagus and goes into the lungs. Simply put, IT went down the wrong pipe. It might not sound like a big deal, but this is exactly why pneumonia is one of the top 3 causes of death among the elderly. It's especially dangerous for Grandpa Taekyung since he just had lung surgery. What's his oxygen saturation? It's 93. IT won't go up even with the mask oxygen turned to the maximum. Move the patient to the treatment room and prepare for intubation. Also, check if there are any available beds in the ICU. Yes, sir. Seonhan. I'm sorry, I know it's your day off, but I need you to borrow a hand. Yes, sir. Alright. Let's move. Doctor. Is intubation absolutely necessary in this situation? That is my judgment. Is it possible for him to recover without ventilator support? Have you read the book called The ICU Book? If you look there, IT says this regarding intubation. Hesitation invites trouble. It means delaying an important decision can cause greater problems for the patient. Vague hope is forbidden for a doctor. To prevent it from worsening into aspiration pneumonia, this method is our best option right now. Decisiveness and charisma. There's such a huge contrast with Dr. Bayan. Should I really go into thoracic surgery? Alright, give me 3 milligrams of a sedative and 10 milligrams of a muscle relaxant here. Wow. One-handed. Normally, an AMBU bag requires a normal adult to use both hands to hold and squeeze it. Is being a doctor all about physical strength after all? Alright, Seonhan. Squeeze the AMBU bag like this from here. A tempo of once every 3 to 4 seconds is enough. Yes, sir. Have you ever done an intubation? No. Not yet. You'll be doing it eventually, so watch closely. Laryngo, please. Yes. Laryngoscope, medical equipment used to view the airway inside the throat. E-tube. Here it is. TSK. There's a lot more phlegm built up than I expected. We're going to need a suction. As expected of the nurses in our ward. They are quick-witted. How did she know a suction was needed just by looking at my eyes? Look at this guy's sense. How did he know I was about to ask for this? Suction complete. Reinserting the tube into the airway. Pressing the thyroid cartilage. Pressing the thyroid cartilage improves the field of vision, making the vocal cords clearly visible and the intubation much easier. What is up with this guy? This isn't the skill of someone who has only done this once or twice. And he's an intern who has only been here for 3 months. I see you've learned well somewhere. Did you rotate through a surgical department before? No. I just applied what I learned during my student days by myself, and this is my first time applying it to a patient. First time? Yes. I did it while thinking about how anatomically it would be more comfortable for you, doctor. I'm not sure if my pressing helped you at all. His basic instincts are excellent. Man. The more I look at him, the more enticing he gets, doesn't he? He. Please, please. Look kindly upon us and send thoracic surgery one smart, reliable intern. One that will never run away. Heh. I've been praying every night for a decent intern to show up and... I'm sorry. I'm late. If you're that busy, you could have just come tomorrow, you know. It's done. You punks. Anyway, looks like we're out of ICU beds again, so he'll have to go back to the surgical ICU. Seonhan, want to help transfer him? Our Seonhan. Yes. Once he's downstairs, he'll be one of my patients anyway. Great, thanks for the help. Why'd you bring this patient back again? Thoracic ICU says they don't have an open bed. Hey, Woo. Be honest. Are you a spy they planted from thoracic? If that patient goes delirious, you're taking full responsibility. I don't care if you act out a whole war drama. Suddenly my lower half hurts just thinking about it. By the way, doctor. What now? If a patient pulls out their own E-tube, what happens? What? Hey. Don't say creepy stuff like that. Pulling out an endotracheal tube would do massive damage to the lungs and the whole body. It'd be on a totally different level from yanking a chest tube. Yeah. I figured. This is bad. If things go the way I saw, Mr. Oh Taek-jong will pull out his own E-tube and end up in critical condition. But if I can just stop that moment from happening, maybe he still has a shot at recovering. The problem is, I don't know when it'll die. His delirium hits at all hours. It could be tonight, tomorrow night. Or even weeks from now. Is there any way to keep restraints on him 24 hours a day? Well, if a patient is really thrashing around, restraints are pretty much the best option we've got. But the ones who are going to pull something out somehow still manage to do it. I've seen a patient twist their whole body and get a line out even with all 4 limbs tied down. Really? Think about it, even a tiny thorn in your throat feels suffocating. Now imagine an entire tube stuck down there. You wouldn't want it out. A lucid patient wouldn't pull it, of course, but in the middle of delirium, anything's possible. In the end, unless the delirium improves, the fundamental risk never goes away. If the underlying illness doesn't get better, the delirium persists. Because of the delirium, the illness worsens, and the vicious cycle just keeps spinning. If I could break that chain somehow. You sure think a lot for an intern, don't you? Even brain scientists haven't pinned down the exact cause of delirium. You think we have some magic fix? The best we can do is tie them down and sedate them when the symptoms flare. But it's not like there's no way at all. What is it? Sometimes delirium patients suddenly get dramatically better. Especially when their family's with them. Family? I mean, it's not exactly a medical solution, but in my experience, patients really are different depending on whether their family's at their side. I have a son. I haven't seen him in about 10 years. It's my fault for living my life the wrong way. Could you try contacting his guardian? I'll give it a shot. But don't get your hopes up. I understand. Please, though, do what you can. How did Agent Orange change your life, Mr. O? Agent Orange, a defoliant the US military sprayed over jungles during the Vietnam War to wipe out guerrilla bases. I was just about to start a new life. When I came back from the war, got married, and had a child, I was truly happy. But at some point I don't even know when my body started to change. I began losing weight for no reason. Strange things happened all over my body, and eventually my limbs started to rot. Because of the dioxin in Agent Orange. A toxin 10,000 times more poisonous than cyanide and 3,000 times more than arsenic. It doesn't break down in the body and can cause all kinds of cancers and neurological damage for years. I never imagined I'd brought such poison back from the battlefield in my own body. Once my hands and feet stopped working properly, I lost my job. Just like that, my wife's life turned into a long road of hardship. But the one thing I can't forgive myself for is passing disability on to my own child. The state did finally acknowledge what happened and offer compensation. Doctor. How did it go? I did get through to the guardian, but he coldly said he has no intention of seeing his father and hung up. You explained how bad your patient's condition is. Yes. I told him everything, but he wouldn't budge. He just yelled that he didn't want to talk about it anymore and that if we had more to say, we should come tell him in person. I'll go see him. Huh? You're going yourself? Hey. Don't waste your time. You're just going to hit a wall. Children dumping sick parents in hospitals is more common than you think. Doesn't even make the news anymore. Even so, I have to at least try. No matter what you do, nothing's going to change. He's not coming. Period. Want to bet on it? Loser shaves their head. Sure. Ha. Even if I lose, summer's coming might be nice and breezy. Ha. 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 This guy's nuts. Huff huff. Yeah, I'm crazy. Totally crazy. What else do you call this, spending my precious day off like this? Welcome. Sit wherever you like. What can I get you? Right. This is the place I saw in my premonition where Grandpa O's son works. Hello. I'm the doctor from Yeonguk University Hospital who called you. Wow, doctors must have a lot more free time than I thought. You really came all the way here just because I told you to. I cut ties with my father a long time ago. He has nothing to do with me. The hospital can boil him or grill him for all I care. I see. But still. There's something I really need to tell you. Have you eaten? Sit there a bit. Since you came all this way, at least have a meal. How is it? It's great. Really delicious. I'm sure business is good. Business is bad. Why? With cooking this good? Who knows? People feel uneasy eating food cooked by someone with a disability. The thing I can't bear is having passed disability onto my own child. So, what is it you wanted to say? Your father's very ill. I know. He has lung cancer. Then. Did you come all the way here to scold me for never visiting? Your father is going to die soon. Did I? My father? Yes. The surgery was a success. But in the vision I saw, he was shaken up. He really is worried about his father's condition. But the surgery. Didn't you say it ended well? I got a message yesterday saying he was just going to the ICU for a bit. Delirium is causing a major setback in his recovery. Delirium? To alleviate delirium, psychological stability is necessary. And for that stability, the best method is the help of family. So, you're saying I need to be by his side? Yes, only you, his son, can improve your father's condition. Of course, I'm not entirely certain about this part. It's not like I can know every future possibility. But right now, it's important to build trust with Haeyeon. You said you're an intern, didn't you? I don't know much, but isn't an intern a completely green doctor? Doctors are supposed to perform surgeries or treat with medicine, but family is the medicine. What is this, some fraudulent shamanistic ritual? This is a research paper on delirium. Even looking at results from international studies, involving the family in the delirium treatment process and bringing familiar objects from home has shown significant efficacy. If you choose not to go yourself, please at least bring some familiar items. It will definitely help. Did you actually study research papers and come all the way here just because of my father? Why go that far? You still seem quite young. But when a relationship between parent and child is this bad, there's always a reason. 10 years ago. When my mother, who did nothing but suffer her whole life because of my father, passed away. I hurled every unspeakable curse at him and cut ties completely. I've lived with our ties severed like that for over 10 years. So how can you ask me to look at my father's face now? Of course, I don't know the full details of your situation. And as you said, I'm still young. Even so, the regretful feelings of the family left behind are something I know all too well. I will say it one more time, but the only person who can help the patient right now is you, his son. Thank you for the delicious meal. I'm still not going to. Doctor. Wait a minute. Will just anything do? Are you saying anything works as long as it's a familiar object? Yes. Anything is fine, as long as it's something that makes the patient feel familiar and comfortable. Like clothes or photos. Phew. Fine. I'll at least try to look for something. Don't bring your expectations up, though. I haven't been to my father's house in over 10 years, so I don't know what's there. If I can't find anything suitable, I won't even bother coming to the hospital, so don't wait up. So you really went out to look for the guardian? Yes. Ha 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 ha, you crazy bastard. You actually went all the way to his house for that? So what did the guardian say? Is he coming to see the patient? It seems his relationship with his father is much worse than I thought. See? What did I tell you? It was a wild goose chase anyway. Would a son who hasn't shown his face in 10 years suddenly come to see his father now? Look over there. Visiting hours are almost over, and nobody showed up. Is there a visitor for patient Yeo Taekyung today? Well. Nothing has been logged so far. Looks like I won the bet. When should we hold our junior's head shaving ceremony? Let's begin the operation. Dr. Cha Wayuare, bring the clippers. Excuse me. Hello. Can I see my father right now? Is he unconscious? He's currently sleeping due to sedatives given for the delirium. Should I wake him up for you? No. It's fine. I'll just look at his face today before I leave. He's aged so much. Father. What kind of story is he telling the father he hasn't seen in 10 years? Is he able to speak freely because the father is asleep? Doctor. I'm truly sorry about last time. And thank you for taking care of my father. Not at all. The doctors and nurses here are all taking excellent care of him. Thank you for coming. Also, this. I tried to think of what might be familiar to my father. And when I went to the house, I found this. Away from home for a long period due to illness. For urgent matters, please contact below. 010 XXXX. Even if a thief broke in, there'd be nothing to steal. 10 years have passed, but it's still exactly the same. A familiar object. Yeah. This will do. A baseball? Your father must have really liked baseball. Yeah. He always said his dream was to play catch with his son one day. Then one day he came home with a baseball. We played catch a few times together. But with these hands, how was that supposed to work? I ended up snapping at him. Asked him how he expected to play baseball with hands like that. That night, he stayed up late crying by himself. And I pretended I didn't notice, right to the end. Back then, I blamed him for everything. I think that's when it all started. He began drinking every day, my MOM was worn out. The more pathetic he looked, the more I hated him and avoided him. Even though he was a victim too. For a grandfather who had to carry the scars of war his whole life, that baseball might have been a symbol of ordinary, everyday happiness. Grandpa, this is the baseball your son sent. He said you used to play catch with it when he was little. Your son came by, you know. He said next time, he'll make sure to see you in person. That sounds nice, doesn't it? His breathing and color both look stable. Must be having a good dream. Yeah. I hope so. A few days later. Grandpa, did you sleep well last night? Doctor. Yes. I had a really good dream. Mr. Otaek isn't showing any hostility toward people at all now. Until recently, he had delirium episodes every night, but he's improved so much it's almost hard to believe. Seems that baseball did the trick, just like you said, Dr. Shin. You know outside items are banned in the ICU, right? What if he decided that baseball was a grenade and hurled it again? Stop worrying about every little thing and hurry up and go say goodbye, Dr. Byun. Senior. I'm holding you to it. There's no way he's the kind of doctor who'd just brush off a promise to a junior. Right? I mean. Father. Grandpa Taekjong's delirium really did disappear like a lie. His recovery sped up, and it looked like he'd be able to leave the hospital before long. Even the future I'd seen had changed. Sigh. I'm taking my meds, but my hair still seems to fall out more every day. This is all that jerk Byun Jiwayunam's fault. Always late, doesn't even bother to learn his patient's conditions properly. In the end, it's my fault for teaching him wrong. No. I can't. Stress makes it fall out even more. Good morning, Professor. Hello. Yes. Good morning. How are? Byun Jiwayunam. Your hair, what is that? Is this some kind of joke? You little. We should start rounds. Let's go. Huh. Patient Choi spiked a fever up to 39 degrees Celsius around 1 a.m. We gave antipyretics and changed the antibiotics. He's stable now at 37.2 degrees Celsius. Patient Kim, admitted with septic shock, had a blood pressure of 70/40 mmHg, so we increased the vasopressor dose. He's currently stable at 160 mmHg. Hey, what's up with you? You're scaring me. People say when someone suddenly changes, they're going to diet and die on me. What's with you? Professor, about the intern evaluations we need to submit them today. It's been a month for this batch. Let's see. This month's intern evaluations. Top score. Evaluation A+, highly recommended date. An A+. That's a first. Up to now, whenever it was something bothersome, I barely listened and just scribbled in some generic comments. What did I even write this time? I was blind to it all this time. A crooked gear has slowly worn itself down. But intern Shin Seonhan was different. His attitude pouring his best into every single patient left a deep impression on me. In a way, he reminded me of myself when I first applied to surgery. I'm supposed to be the one teaching, but I've actually learned and felt a lot from intern Shin Seonhan. From now on, I'd like to return to my own beginnings. Wow. Again. Is this an intern evaluation or a confession letter? That Byun Jiwayunam. Honestly, what a guy. Approved. Nurse Cha, why you aren't going somewhere fun? Dr. Shin Seonhan. It's Friday night. I'm meeting some friends. Dr. Shin, you don't have much time left at our hospital. You should cut loose a bit too. Or you'll burn out later. Yes, ma'am. Come to think of it, this is his last week on rotation here, right? Thanks for everything this month. Oh, please, you're the one who made things more fun around here. I'm going to miss you. You're still planning on becoming a surgeon at our hospital, right? Of course. Good. Then I'll get to see you and Wang Sungwoo around a lot. If I survive working here, that is. Hey, you'll be fine. Don't sell yourself short. I'm sure you will make a great surgeon. I've got a good eye for doctors, you know. Thank you. Alright then, I'm off to enjoy my Friday night, you hang in there too, Dr. Shin. And just like that, my month of May as an intern was coming to an end. The latter half of May felt a bit lighter for a lot of US. Dad 010 XXXX in the middle of all that. How much have I grown? Dad, it's me. Yeah. I'm heading home tonight. Want to grab some SOJU together? Did you secure an ophthalmology slot? I've been asking around, but no one's selling. I'm aiming for rehabilitation medicine, but I can't find a single listing. Did the rest of you get the residency slots you wanted? No. I need to start looking now. You'd better hurry. If you don't look fast, they'll all be gone and you'll be too late. It's not like we're bartering goods. This is an absolute pain. What can you do? The schedule is completely randomized in the first place. Listings. Buying and selling residency slots. It might sound bizarre at first, but the interns have their reasons. The 1 year of internship is a critical period. To apply for your desired residency, you must complete an internship in that specific department. In other words, if you want to become an ophthalmology resident, you must complete an ophthalmology internship. However, the hospital basically assigns the intern schedules at random. Consequently, you might not get assigned to the department you want. Anyway, hurry up. I heard people buy and sell the highly popular departments with cash. What? Seriously? Of course. If you want something, paying the price for it is just how the world works, isn't it? Hyung. By the way, can I have one of your cheese pork cutlets? No way, man. Do you know how long I stood in line for this? Did you hear what I just said? I said if you want something, you have to pay the price. At least bring me a side dish of similar value. Anchovies. I should probably secure my schedule soon, too. Which department are you looking to rotate through? Thoracic surgery. Whoa. You could probably get thoracic surgery within 30 minutes if you wanted to. Out of more than 20 departments, it's at the absolute bottom of the barrel. So, which department is the hottest this year? The oldies but goodies. Dermatology, ophthalmology, and plastic surgery, plus orthopedics, rehabilitation, and radiology are the traditional powerhouses, aren't they? Dermatology. Grade, SSS. Undeniably the rarest card of them all. Only 1 intern slot per month. Plastic surgery. Grade S. Number 1 in competitive rate for resident applicants nationwide. The dream of owning a building in Gangnam. Rehabilitation medicine's demand is skyrocketing with the increase in nursing hospitals. The place frequently visited by sports superstars. Radiology S. Leaving work right on the dot at 6 p.m. Sitting at home watching Netflix. Psychiatry S. Recent surge in societal demand. Securing an unrivaled domain. Especially this year, plastic surgery and psychiatry are super popular. I'm looking into them myself. Ugh. I actually have both of those. You have both plastic surgery and psychiatry? Yes. Right here. Gasp. If you haven't traded yet, trade with me, Seonhan. I'll give you whatever you want. What else do you have? Limb. Radiology. And rehabilitation medicine. What? Hey. Isn't this a system error? How do you have all of the ultra-popular cards? You don't happen to have dermatology too, do you? Oh. No way. I have dermatology, too. I got it in June. What? Are you freaking kidding me? Chime. SHIT. We're in big trouble. Intern noticed to prevent chaos caused by frequent schedule changes, we would like to inform you. All interns must confirm their schedules within May. Deadline, May 30th at noon. Today is the 27th, they want us to finalize our schedules in 3 days. Isn't this too much? Seonhan. We need to. Seonhan. Where the hell did he go? My schedule ahead is definitely looking great. All of them are popular cards at grade S or higher. But none of these are specialties I'm particularly interested in. I'll just have to trade the departments I don't care about. Thank you for your hard work. There he is. Wait a minute. Seonhan. OPPA. Seonhan. Let's grab a meal. What do you like? Steak. Lobster. Do you need anything? Want me to lend you my department store VIP card? Seonhan OPPA. I have a friend who models, do you want to go on a blind date? The rumors spread already. These guys barely even talked to me before because I graduated from a third-rate university. Why are they acting like this? Phew. I barely managed to shake them off. Everyone is going crazy. So damn. What are you doing? Seonhan. Trading schedules. I thought I needed to decide quickly. I heard. You have a golden ticket schedule, right? Yes, but... Unfortunately, they don't have the department I actually want. You said you wanted to go into surgery, right? Yeah. Do you happen to have thoracic surgery? No, I don't have thoracic surgery. What are you looking for, so damn? Me. Radiology. First of all, you don't have to see patients directly. Though there are days when you have to read scans in the same spot for hours. Well, I think it fits my personality perfectly. That's true. You've always had a keen eye, so damn. You were the first to find the bleeding point on that ER patient, too. Thanks to that, the patient survived. Huh. You remembered all of that. I was just feeling proud about it by myself. I have radiology in July. Take it. What? Really? Yeah. It'll be good for you to rotate through it in advance to see if it fits your aptitude. Hey. No. Why? My July is neurosurgery. It's way too much of a loss for you. Neurosurgery is an avoided specialty, notorious for being just as grueling as thoracic surgery. I like it. I want to rotate through as many surgical departments as possible. Are you really going to be okay with this? Yeah. My other cards are great anyway. Oh my god. You actually have all of these. I have nothing to give you in return. It's fine. Just buy me a cup of coffee later. I'll buy you 10 cups, no, 100 cups. Thank you, Seonhan. Sure. Make sure you secure that radiology slot. Oh, I'll give you a tip I heard from a senior. They said to absolutely choose an easy department for November and December. They said it's better to choose a department that gives you some free time to study for the residency exam at the end of the year. That makes sense. I hadn't thought that far ahead. Thanks. I'm glad it helped so damn. I also secured a surgical slot. It's the ultimate win-win. What should I do with the remaining cards? It feels like a waste to just give them away. Especially since dermatology is the best card of all. Seonhan. How obnoxious. Did you finish your ICU rotation well? How was it? Now, put it away. Did he hear the rumors too? He still hasn't taken the cast off his hand yet. I heard he got into a few fights while drinking even after that day. What's going on? You have the dermatology schedule, right? I was wondering if you wanted to trade with me. Look at this guy. Is he aiming for dermatology, an SSS grade card? I'd give it to anyone else, but never to you, jerk. Coincidentally, I have thoracic surgery in June. I heard you're looking for thoracic surgery. If we trade, it's a win-win for both of us. Win-win, my foot. Joe Jinji. Are you kidding me right now? You say win-win. Joe Jinji, are you joking right now? You can get a thoracic surgery schedule anywhere, but not dermatology. You want to make a 1-to-1 exchange when the rarity is different? Fine. Then. How about I add 500,001? T/N, $338. Then. 1,000,001. T/N, $675. Fine. 2 million. No more than that. Is that all you can offer? You're only willing to invest 2 million for your future. 3,000,001. I really can't give any more than this. Sir Seonhan. Please, I'm begging you. Let me see your schedule. Oh. He was hiding some pretty good stuff, huh? I'll take thoracic surgery in June, so you have to give me this too. Huh. Family medicine in November and pathology in December. What? Just as Sodam said, it's important to secure personal time to prepare for the residency exam at year's end in November and December. Both family medicine and pathology are relatively relaxed departments. Hey. Asking for this is too much. This is such a sweet schedule. It has to be at least at this level for things to balance out, right? You won't be able to get a dermatology schedule anywhere else UUGH. If you don't want to, say so. I'll just give it to someone else. Fine. I'll swap. Take it all. Take it all. Deal. Then I'll send the payment details via message. What? The 3 million one was included too. Why not? If you become a dermatology doctor, isn't that just a night's worth of drinking? If you don't want it, then forget it, this devilish son of a bitch. Fine. I'll send it. This is the thrill of abusing one's power. I should buy some delicious meat for the kids. You specialize in thoracic surgery. But I heard you started with general surgery. Professor Beck. Yes. Unlike Korea, in the US you must complete a 5-year residency in general surgery before becoming a thoracic surgery resident. 5 years of general surgery. And after that, you need to complete a 3-year residency in thoracic surgery to finally become a thoracic surgeon. Wow. So that's 8 years of training in total. That's really a challenging path. Then what is it about thoracic surgery that allows you to endure such a long time? The charm of thoracic surgery. What do you think death is? Pardon? Well. I guess death is the stopping of the heart. Can death truly be defined that simply? You are correct. In simple terms, one could say that when the heartbeat is 0, it is death. However, there are only a few people who can bring a patient with a 0 heartbeat back to life. It's something normal doctors can't dare to approach. That's the world of thoracic surgery. Erg. Wow. Every time I see it, he's so cool. I've secured both neurosurgery and thoracic surgery and have plenty of time before year end. I've shared the needed departments with Gunyuke and Jungwon, and this has successfully completed my schedule. Finally, in June, it's thoracic surgery. I'm getting a step closer to Dr. Baek Yuzin. Seonhan. Eek. Look at the posts. It's going wild right now. What's going on? Does everyone know about the couple born from the dispatch this time? Intern Song and Lee. Haha, isn't it Kim and Cheon? I know about Jin and Jong. What? So there are 3 couples. Ha. Amazing. It seems there's some magic in the dispatch. When fresh young interns see each other every day at the beach, hearts flutter. I need to secure a dispatch schedule too. I'm not interested in other people's romance. I'm busy enough taking care of myself. Boring. Anyway, it seems 5 couples have already formed in the dispatch. Perhaps that's why the value of dispatch schedules is suddenly skyrocketing. Dispatch work. Literally, IT means temporarily leaving Yeonguk University Hospital to go on a month-long assignment to a hospital in a different area that lacks personnel. Hee. Seonhan, you're going in August, right? Yeah. I passed the psychiatry position to Jungwon Hyung. I'm also going in August. Ha ha ha. I'm already excited. My romance will unfold at a small hospital by the beach. Thoracic surgery June internship assignments adult heart, Yu Youngjun, Lee Junhwa, Kim Soo pediatric heart, Kong Joi lung esophagus, Sun Jae-min, Shin Seonhan, on Kielman. This month is the lung esophagus part. I was hoping for the heart part. The lung esophagus part. When you think of thoracic surgery, people often think it only involves heart surgery, but thoracic surgery also covers the lungs and esophagus. I anticipated this and applied for the thoracic surgery schedule twice. I should be able to experience the heart part next time, right? Seonhan Hyung, long time no see. Ryu Myeonjin. I heard you changed to thoracic next month. I heard the rumors. You ditched dermatology to get thoracic surgery. I've always wanted to try thoracic surgery. So I switched too. Huh. I was originally assigned to a different department in June, but I added thoracic surgery. I wanted to do a rotation with you once. Then I'll see you next month. Shin Seonhan. Hyung and him. Why did he make me his competition? Ugh. So bothersome. But why isn't Yeonseo here? For the past month, Yeonseo has been an intern in thoracic surgery. Today, the final day, she was supposed to hand over her duties to me. Are you alright? OOPPA, hello. Yeonseo. What happened to her after just 1 month? What kind of place is thoracic surgery anyway? Hey. What on earth happened to you? I look like a puppy that ran away and came back home, don't I? You'll understand once you complete your rotation in thoracic surgery, Seonhan. What kind of place is thoracic surgery for her to? You read the handoff sheet, right? Yeah. I read it several times. But is it true that interns act as the primary attending physicians in thoracic surgery? If so, you must really feel like a real doctor. Right? Well. That is all because of the severe staffing shortage. Thoracic surgery has far too few residents compared to the number of patients. We are licensed, legitimate doctors, of course, but it makes absolutely no sense for interns who rotate out after barely a month to be the primary physicians. Out of the 20-odd departments at Yeonguk University Hospital, thoracic surgery is the only one that does this. Treatment room HUI. On Jiang Sik. Don't you ever lay a hand on my patients again. I'm sorry, sir. You think being sorry is enough? Does this order even make sense? Huh. Keep your head in the game. You hear me? What's that noise? That's the sound of the thresher running. The thresher? It's Professor Han Sang-ji, the mental thresher. Once he starts ripping into you, your sanity gets completely shredded. Is the atmosphere in thoracic surgery always like this? I shall cast off the chains and shackles of thoracic surgery and leave to find my happiness. Stay happy, Seonhan. Goodbye. Hey. W8. Oh. You're finally here. I've been waiting for you with bated breath. I heard you actually went out of your way to request thoracic surgery. Hello, sir. I am Shin Seonhan. I will do my absolute best. Right. Such a good boy. So very, very admirable. You know the general thoracic interns are supposed to gather in the conference room by 6 o'clock, right? Let's go. You'll get to meet the other interns there. Oh. Yes, sir. If you're going to do things this way, quit medicine right now and do something else. Don't worry. It's nothing. Honestly, he's on the gentler side compared to the other thoracic surgery professors. At least he doesn't grab you by the collar and punch you in the mouth, right? What? Pwahahaha. It's a joke. Gak. Was that really a joke? But sir, do thoracic surgery interns mostly just do attending physician busywork on the ward? Or is there a chance we might get to enter the operating room? The operating room? It's far too early for the operating room. Then what about a chance to perform an intubation on the ward? You saw an intubation the other day and got eager to try it yourself, didn't you? You're the type who likes working with your hands too, I see. Your hands are itching to do something, aren't they? Eager to grab a scalpel, slice right in, and sear things with the electrocautery. Right? That's not entirely wrong, but it sounds so terrifying when you put it like that, sir. Great. Excellent. It is highly commendable for an aspiring surgeon to have such a drive for clinical skills. No need to rush. The world of thoracic surgery is deep and profound. Dr. Song Yuju of thoracic surgery. The person who skillfully initiated the ECMO incident in my first month as an intern. Hello. I am Shin Seonhan, the intern assigned to thoracic surgery starting this month. Dong Seop, who is this little greenhorn? The most promising prospect among this month's interns. A promising prospect? Didn't you see the news? The passionate doctor of Gangnam Station. The fellow who supposedly performed a pericardiocentesis right in the middle of Gangnam. If you search for Yeonguk University Hospital intern on the internet right now, his face is the first thing that pops up. He's the most decent guy among all the interns I've seen. I saw him helping with an intubation the other day, and he was quite sharp. All interns are basically the same. Sit down. Let's get this over with as soon as possible. You're here. Ryu Myung-in. Must be nice. Getting recognized as a rising star from day one. Was this jerk assigned to general thoracic too? How annoying. Good evening. You're 1 minute late. I'm sorry. You're smiling. I am sorry. I was wrapping up my tasks as the orthopedic surgery intern. Quiet down and take a seat quickly. Alright, eyes on me. This June, our fourth-year residents are assigned to pediatric cardiac and adult cardiac, so I will be acting as the chief of general thoracic. I'm Ma Dong-seop, don't be too scared, and let's have a great month together. From here on, the general thoracic interns will be split into Group A and Group B for the month. I will take charge of Group A, and Dr. Song Yuju over here will take Group B. It would be nice if I ended up in the same group as you, Hyung. I don't want to spend even a single hour with you. Now, choose one of these characters. Shall we let Seonhan, our eldest, choose first? Sound good? Yes. I will choose. What? Is it starting again? We're in the hospital backyard, aren't we? Dr. Song Yuju and Dr. Ma Dong-seop. I heard about it. A major incident happened in your group, didn't it? Hypoxic brain injury. Brain injury? This is exactly why we shouldn't leave only interns on the ward. Of all times, it had to happen when the residents were all in the operating room. Did one of the interns make a mistake? Since thoracic surgery deals with vital organs like the heart and lungs, a critical situation can arise at any moment. The intern's judgment itself wasn't wrong, since the patient's life was in immediate danger. However, their ability simply fell short of their ambition. That's true. It probably would have been the same no matter which intern we put there. A patient suffered a brain injury due to the inexperienced handling of one of the interns. Out of the 4 of us, who? He might have gotten ahead of himself and made a mistake because everyone around was hyping him up as a rising star. A rising star? What? Wait. Is this about me? Am I the culprit? Judging by the phrase, rising star, it's almost certain. Me. It seems I've won this month after all, haven't I? Don't feel too bitter about it. After all, competition always requires a bit of luck, doesn't it? You should have chosen your character wisely on the first day. If you had chosen the snake like me and joined Dr. Ma Dong-seop's group, things would have gone smoothly without a hitch. But you just had to choose the lion. By the way, it's quite a shame. If I had been here, I wouldn't have let the patient end up like that. Seonhan. Yes. Let me get this straight. If I choose the lion right now, I'll end up in Dr. Song Yuju's group, and I will make a mistake that leads to a patient's hypoxic brain injury. And my evaluation score will fall behind this guy's. If I choose the snake, I'll end up in Dr. Ma Dong-seop's group. Finish my internship safely, and get a good score. I will choose the lion.